And I noticed some of us are still seated. The room is a bit, the degree is a bit um, cold, or the Celsius is cold in here. So I found to these to bring some coffee, something warm with we continue moving of the ground. We're not thank you very much for being here today. Yeah.
Lagos, healthcare has always been powered by resilience. From the nurse who begins her shift before sunrise, to the doctor racing between patients, to the families who rely on a system. In Lagos, healthcare has always been powered by resilience. From the nurse who begins her shift before sunrise, to the doctor racing between patients, to the families who rely on a system that works twice as hard as it should. But now, something extraordinary is changing the story. The Lagos Private Health Partnership, LPHP, is transforming healthcare from the inside out, quietly, intentionally, and at a scale never seen before. It's more than digitizing hospitals. It's about giving every provider the tools to work smarter, not harder. It's about shifting our system from reactive care to proactive, data driven health for all. LPHP is helping turn our brain drain into brain gain, building systems that keep skilled professionals here at home while attracting global expertise to Lagos through technology, remote collaboration, and modernized workflows that match global standards. With modern tools, seamless collaboration, we are creating an environment where talent doesn't just stay, it thrives. HMOs and providers now operate with more transparency, faster payments, and fewer disputes. Hospitals regain time that once disappeared into paperwork and can redirect it back to patient care. And here's an impact many won't notice immediately, but will feel more doctors on duty, cleaner facilities, working equipment, shorter waiting times, and even more affordable care over time. Healthcare stops being a burden and becomes something that works for the people, not against them. As waste reduces, efficiency increases, and resources stretch further, providers can invest in quality, staff training, equipment, and stronger patient outcomes. PHP is building a system where quality care doesn't come with the price of financial catastrophe. By streamlining payments and integrating insurance, we are directly reducing the crushing burden of out of pocket expenses that push households into poverty. For Lagos, it means a more resilient health system, one capable of delivering equitable care to millions without collapsing under pressure. This is more than a program. It is a promise, a commitment to a healthier, more financially secure Lagos. As the foundational architecture for universal health coverage in Lagos, LPHP will enable the state to achieve measurable results. A 70% insurance coverage rate within the first 5 years, a 40% reduction in catastrophic out-of-pocket health expenditure, a sustained increase in the health sector's contribution to Lagos GDP, and the reversal of professional brain drain through viable economic incentives for health workers. In doing so, Lagos will not only fulfill the spirit of the NHIA Act of 2022, but will set the gold standard for subnational implementation. A model of cooperative federalism, fiscal prudence, and social equity.
Yes, ladies and gentlemen, you're welcome once again to the launch of the Lagos State Health Financing Reforms featuring the Lagos Private Health Partnership. Please collect your indulgence of those who are still having their coffee, networking outside. So please make their way back into the hall. We're about to start now. Thank you very much, all of you, for being here. We're delighted to have you join us this morning to be part of history, to be part of the milestone, to be part of those who are ensuring that we have access and affordable healthcare for Lagosians. Please, those who are outside, please make your way back into the hall. We are happy to have you join us again. You can have your coffee promptly or fast as much as you can and make your way back into the hall so that we can start in earnest. I also like to say for those of you who are seated at the back, please can you fill up the spaces in front of you, not necessarily those reserved. For those of you seated at the back, it's not good for the optics of the camera. Please, if you're seated at the back, please make your way forward. Fill up the spaces in front of you. Thank you very much. Thank you. Just fill up the spaces in front of you. Those outside, please can you make your way back into the hall? Thank you very much. At this point, I'd like to make some few announcements. I call it housekeeping rules. Distinguished guests, ladies and gentlemen, in case you need to make use of the convenience or the restrooms, please, you can go to the first floor or to the ground floor. There you have the convenience. If you want to make use of the convenience, all you need to do is in case of emergency, please don't make use of the elevator. Find your way downstairs, make use of the stairs. Thank you very much. And perhaps because we have so many health practitioners here, I do understand that you know the importance of safety. So I crave your indulgence. In case of emergency, allow the ladies to go first while the male audience to just escort the ladies first. Just be a gentleman. And and for the ladies, please don't bother about your bags or your phone. Just go outside. It's an emergency. Thank you very much. At this point, I'd like all of us to have our phones on silence. Don't let it ring out so that you won't be the person that will be paying attention to in the course of the program. Thank you very much. And the last but not the least, I'd like to appeal that every time I say, can we put our hands together? Can we have an applause? I'd like to say, you will encourage me, but most importantly, you will do yourself a world of good by clapping. One, I am not a medical doctor, but I'm aware that with clapping, you can literally exercise all by yourself by putting your hands together. And I mean, the health benefit of clapping is or are tremendous. One, it improves your blood circulation, stimulates acupressure points, boosts mental health, strengthens immunity, supports respiratory health, and reduces joint pain, and energizes your body. Ah, thank you very much. I just enumerated, some people got the points, some of you didn't. It means you should put your hands together, ladies and gentlemen. So if you grow up where, or you are from the background I come from, where in the church you literally clap from the beginning of the service to the end, you will understand. But what it does primarily is save you the stress of going to the gym today. By the end of today's proceedings or this event, when you clap, you'll be healthier and you'll be better. Distinguished guests, ladies and gentlemen, can you put your hands together for yourselves for being here today? Some are still not clapping. It is okay. Ladies and gentlemen, I want to say welcome to the launch of the Lagos State Health Financing Reforms featuring the Lagos Private Health Partnership. Well, it's all about harmonizing public and private health insurance towards universal health coverage in Lagos State. At this point, I'd like to recognize some of our dignitaries here present. And I, I observe that, yes, there he is. Please, can we recognize and welcome the brain behind this initiative as well as the driver as well. Please put your hands together for the Honorable Commissioner for Health, Professor Akin Abayomi. There he is. Thank you very much. And seated close to him, to his left, is the Chairman, Health Service Commission. Thank you, Madam Tatinoko Anoyega. It's a pleasure to have you join us here today. So, at this point, this an aside. Balance for my performance here has not been paid. And I'm sure it's also predicated on how you clap and you respond. So if you want to clap, make it resounding, make it lusty. I mean, let it be resounding. So if you want to clap that the chairman of the Health Service Commission is here, will you please do that better, ladies and gentlemen? Thank you very much. We also have the chairman Lashma here with us, Dr. Adebayo Adebayo. Please, can you put your hands together for him? You're welcome, sir. Here with us this morning are members of the Body of Permanent Secretaries here present. I'd like to recognize some of them here today. We have the Permanent Secretary, Health District 2, Dr. Dayo Lajide. Good morning, ma'am. We're happy to have you. We have the Permanent Secretary, Health District 3, Dr. Mansurat Adeleke. It's a pleasure to have you here with us. We also have the Permanent Secretary, Health District 6, Dr. Olufemi Omololu. Thank you very much, sir. We have the Permanent Secretary, the farmer, Dr. Abiola Ido. I saw her in green dress. Okay, I guess she went outside. She's welcome. I'd like to recognize the senior special assistant to the governor on health, Dr. Oluwatoni Adeyemi. Thank you, ma'am, for being here. So just a detour. If you are the owner of this car, your attention is needed outside Highlander AKD 844JV. I think you're obstructing a car, or better still, your attention is needed. Hopefully, it's not an emergency. Ladies and gentlemen, I'd like to acknowledge as well the president of Healthcare Federation of Nigeria, and of course, she's also a panelist. Please, can you give her a round of applause this morning, ladies and gentlemen? She's in Jide in Dili Pharmacist Foundation. Thank you very much for being here today. We appreciate your presence. I also like to recognize Commissioner 4 of the Lagos State Health Service Commission, Dr. Ololade Fadipe. Thank you very much. Thank you very much, ma'am, for being here today. I'd like to recognize all the directors in the health family here present, top functionaries and heads of ministerial agencies, captains of industry, Senior Vice President and Chief Corporate Services Officer, IHS Towers, Mr. Dapo Atula. It's a pleasure to have you join us here today. So let's give him a round of applause, ladies and gentlemen. I'm aware that the DG National Electrical Contractors Association is here. Dr. Wale Smart Oyeride, represented by Director Legal Regulatory and Taxation, Thompson Akpagio. You're welcome. Where is he? Oh, you're welcome, sir. Thank you. Are we related to the Senate President? We'll discuss after this because there are some things I need to discuss with you. Ladies and gentlemen, please can we make welcome the MD CEO of Aliko Dangote Foundation, Zoera Yusufu. You're welcome. Where are you so that we can acknowledge you here today? Please, oh, there she is. Can you give her a round of applause, ladies and gentlemen? Thank you very much. Health development partners and stakeholders here present, public and private health practitioners, members of the health family here present, distinguished guests, ladies and gentlemen, gentlemen of the press, I want to welcome you once again to this very important occasion. Now, some of you, uh, perhaps during the period when there was a shutdown of government in the US, you know that you can apply for your visas, and some of you were turned back and given another date. Now, one of the core contention for the UNPAS in the United States was the fact that the Democrat wanted an extension of what we know as the Obamacare. Even though some of the Democrats in the Senate and House of Reps backed down, but that was the major contention, and it's all about access to healthcare for everyone, irrespective of a position or where it comes from. And I think that's going to extend to millions and millions of people. And here in Nigeria, we've had a track record of national health insurance since the 90s to Lashma here in Lagos, as well as to the act signed by Mr. Governor last year to make sure health insurance is affordable, not only to those who can afford it, but to that common man on the street, a carpenter, the akara seller on the street of Lagos. I think for those who are championing this very laudable cause, I think they deserve a resounding round of applause, ladies and gentlemen. I'm not too comfortable with the applause because that's the reason why we're here. Sometimes the private sector, they've got bold ideas and because they've got the financial capability. Government is not in the business of running business. Of course, government can provide the enabling environment as well as water the ground, sow seeds, be partners. And I'm happy that we have very critical stakeholders here this morning who are ready to partner with the Lagos State government to provide affordable and very accessible healthcare millions of Lagosians. For that, you deserve another round of applause, ladies and gentlemen. My name is Joshua Akinbola Murakio, and it is a pleasure to be the company for this event. I'm a broadcaster and MC as well. Distinguished guests, ladies and gentlemen, without much ado, I'd like to welcome someone who whose other name is called resilience. Distinguished guests, ladies and gentlemen, as we launch the Lagos State Health Financing Reforms and unveil the LPHA platform, it is only fitting we hear from the man who has been championing equitable access long before it became today's headline. Some say he thinks about universal health coverage even in its sleep, which is why Lagos keeps waking up to reforms like this. Ladies and gentlemen, Please let's make welcome for the opening remarks the Honorable Commissioner for Health, Lagos State, Professor Aki Bayani. Please, can you give him a resounding round of applause, ladies and gentlemen? Clapping, keep clapping, keep clapping. You're welcome, sir. Thank you very much. I think you're making use of this.
Good morning, everybody. Has the protocol been soundly established? On that note, I'd like to welcome all of you. The Executive Governor of Lagos State, Mr. Babajide Olushola Sanwo-Olu, the Director General of the National Health Insurance Authority, Dr. Kelechi Ohere, senior distinguished members of the Lagos State government, our partners across public and private sector, leaders of our healthcare ecosystem, gentlemen of the press, distinguished ladies and gentlemen. We gather here today under a single unifying theme, transforming delivery in Lagos State through sustainable financing reforms. This movement signifies a new covenant with every resident of the state, a covenant that says healthcare should not be a privilege determined by wealth or chance, but a guaranteed right supported by a functional, equitable, and sustainable financing system. For too long, Lagos has contended with a paradox. We are a $256 billion GDP powerhouse, the beating heart of Nigeria's economy, and some would say of the continent of Africa. But yet, the scale of healthcare financing within our borders has remained far below what is required to match the health needs, both curative and prevention, of our population. This mismatch has produced an ecosystem strained by inadequate risk protection, fragmented purchasing, and widespread dissatisfaction amongst stakeholders. The health insurance ecosystem, designed to catalyze health financing, has struggled to achieve its intended impact. There are several deep-rooted issues that have contributed to this underperformance. Number one, poor compliance with mandatory health insurance laws for workers and residents. Number two, an unhealthy rivalry amongst HMOs, resulting in unsustainably low plan pricing. Insured patients routinely denied access to care or confronted with bureaucratic hurdles. A nice way of describing stigma. Restricted access to certain hospitals by many private plans. 4, providers unable to deliver high quality care due to inadequate reimbursements and delayed payments. 5, patients are forced to pay out of pocket even when they are insured, simply to receive dignified care. And an overarching lack of trust across the value chain. The consequences are predictable. A system filled with unhappy people, unhappy enrollees, unhappy providers, unhappy payers, each carry an unmet expectation that is eroded the confidence in the system, leading to the well-entrenched phenomenon of brain drain, or as we call it, JACPA, and the significant and increasing outbound medical tourism. Today, we try to end this chapter. The Lagos State government has responded to the cries of the value chain and is going to act decisively by catalyzing the establishment of the Lagos Private Health Partnership, known as LPHP, a collaborative procurement and delivery framework that unites key stakeholders in the private health care ecosystem. Every transaction leaves a compliance and quality footprint. Data replaces speculation, and transparency replaces assumptions. On this platform, HEFAMA, our medical accreditation agency, will strengthen its regulatory oversight, ensuring that every enrollee receives the level of quality care mandated under Lagos State standards across every accredited facility and through every participating HMO. Furthermore, the Ministry of Health will soon issue comprehensive guidelines and enforce full compliance with the executive order on the mandatory health insurance that has been signed by His Excellency on the 16th of January 2024. If you haven't noticed, LASHMA, our insurance agency, has been very busy promoting the awareness around the executive order and the mandatory nature of insurance that now ensues. The whole idea, according to Mr. Governor, is that we should give the citizens of Lagos a time frame of about 6 months for us to do deep sensitization before the Ministry of Health, its agencies, and LASHMA in particular will start the enforcement process through task force, high-level and intermediate-level task force. This enforcement is essential. Without compliance, no financing system, no matter how sophisticated, can achieve universal health coverage or guarantee meaningful protection for our people. With the LPHP, we are shifting from rivalry to partnership, from opacity to transparency, and from a health system that rewards the cheapest plans to one that rewards value, outcomes, and trust. The premiums of the healthy and the secure will strengthen the risk pool, while providers will finally receive the reimbursements necessary to deliver dignified, people-centered care. And the most important people, our residents, our citizens, will access the quality healthcare they deserve without fear of stigma, without fear of financial hardship and catastrophic spending. This is the future that Mr. Governor wants to build. A state where health is not purchased through hardship, but guaranteed through solidarity. A state where innovation, inclusiveness, and enforcement work together to deliver a private health sector befitting Africa's most dynamic megacity, a state where collaboration replaces fragmentation and where the health of our people becomes a driver of economic expansion, productivity, social stability, and global competitiveness. Today, the Lagos Private Health Partnership begins that journey. I invite all stakeholders present, providers, HMOs,
for being here today to be part of history. Ladies and gentlemen, at this point, we'd like to hear a few words of goodwill, and I'd like to start with someone that can speak to perhaps what the people are passing or going through in his capacity. Please, and that is the National Employers Consultative Forum. Please, can we make welcome the representative of the BG, Dr. Wale Smart Oyemide, Director, Legal, Regulatory, and Taxation, Mr. Thompson Akpabio. Please, can you give him a round of applause, ladies and gentlemen?
Good morning, everybody. Good morning, everybody. Your Excellencies, permit me to start by saying the name is Nigeria Employers Consultative Association, NECA. Nigeria Employers Consultative Association, NECA. Actually been in existence since 16th of January 1957 and is a private sector engagement platform where we have businesses as our member. So when I say members of NECA, this also gives us another platform, other options that are open to us to take advantage of it so that we can equally key into it and ensure that service is being rendered. But permit me, why saying that? In terms of the partnerships, there are a couple of things that we may need to take on board. Once, when the Honorable Commissioner was speaking, he used the word insurance. And I look at item 33 of the exclusive list of the 1999 Constitution. That health insurance will be coming under NICOM, or the partners within the health insurance ecosystem, the HMOs, will be coming under that platform. Two, we should be looking at things like pricing regime. What will be the pricing be? Why should I leave one HMO or one health insurance plan for another? Then three, we should be looking at the workability of it in terms of the package. What package do we have in place? What would be the reason that is convincing enough for me to jettison one platform to the other? Then four, again, we're looking at, would it avoid things like double jeopardy? Because our members have actually been complaining about double jeopardy in terms of these and several others. I see the Honorable Commissioner nodding, which means he quite understand. Then conclusively, in terms of the quality of service, the quality of care, the drugs, and all of that, will it be pocket friendly? And these are some of the things which we need to take on board. We want to commend the Lagos State government, commend the Honorable Commissioner, commend everyone that has been part of this for this initiative. And as we launch this scheme today, we look forward to more engagement. We look forward to a rewarding ecosystem. We look forward to an atmosphere whereby it will be a win-win for everybody. On that note, I say thank you so very much and God bless you all. Thank you.
Please, can you give Mr. Thompson Akpabio another round of applause, ladies and gentlemen? Well, if you hadn't itemized those 4 points, I would have wondered what he's doing here representing an association that deals with employers and consultative people. I mean, that is his responsibility. And being a legal a director of legal, regulatory, and taxation. He understands perhaps the legal side of it as well as the financial part of it. Please, can we give him another round of applause, ladies and gentlemen? We'll still take more goodwill messages, and I'd like to invite warmly the President Healthcare Federation of Nigeria, is Njide Ndili. Please, can you give her a round of applause, ladies and gentlemen? Okay. I don't mind to do this. It's part of my job. Please, when I ask you to put your hands together, please can you do that resoundingly? Can we put our hands together, ladies and gentlemen? Thank you.
Good morning, everyone. I'm freezing. I don't know about you. I was like shaking over there. So if my voice is shaking, it's the cold. Permit me to stand on existing protocols. So I'm here representing the Healthcare Federation of Nigeria, but I'm also the country director for Farm Access. And I must say that the tide is shifting, and it's shifting in a positive direction because this is really a private sector collaboration. And I think that the private sector organizations in health have been waiting for this day. And Lagos, as usual, is setting the example. Whether we like it or not, with the shifting ODA, overseas development assistance, and the fact that it's going down now moves responsibility and support directly on the laps of private sector. So we're very happy to be in the room. We need to begin to treat private sector as the MVPs, which they are. What the private
Adopted, or better still, they need to be pushed. Lagos blazed the trail. Please, can you give Lagos another round of applause? And it's also good and exhilarating to hear the fact that she said, we are ready and eager to be part of this. So I think we have a significant number from the private sector that want to collaborate. Please, can you give yourselves a round of applause, ladies and gentlemen? So, ladies and gentlemen, we still have a couple of goodwill messages to have right here at this forum. Please, can we make welcome for his goodwill message the National Advisor of HCPAN on Health Insurance Matter, and of course is a member of NMA NHA Committee on Health Insurance. Please put your hands together for Dr. Jimmy Arigba Buwo for his goodwill message from HCPAN. Okay, I'm going to give out, I know that you're very wealthy, but I'm going to give a recharge card to the best person that I can see is enthusiastic about clapping. Please get hold of. Can you welcome me once again with a show of... Yeah, thank you very much. You're welcome.
Appreciate this gesture given to me, but first thanking the Honorable Commissioner for Health, Lagos State, who I believe is standing in for our Executive Governor of the state. I equally want to appreciate all other eminent personalities, and especially also my friend, Dr. Bayo Adedewe, whom for your presence, perhaps you're an activist. So, but this time around, the music may change today. It may change because there is now a revolution coming up. We have the National Health Insurance Act of 2022 being domesticated. I think this is part of domestication, both taking the horizontal direction. I must confess at this level that the private sector especially the Healthcare Providers Association of Nigeria. When you hear HCPAN, most people might not understand the full meaning. We are the common umbrella for medical doctors, dental surgeons, nurses, pharmacists, laboratory scientists, radiographers, name them. All these stakeholders who have come under health insurance. And there's the term of 70-70-70. The 70% rural dwellers, 70% of healthcare needs that is being provided by the private sector. The fact that we are seeing almost 70% paying out of pocket. So we want to put paid to this. And this looks to us like a reversal round of medical tourism. And we want to bring in Jakpada as our focus. Apart from this, there seems to be an interest to do public-private partnership. But then the terms spelled out clearly but acceptable to both parties. People do say government have no business in business. But then government can bring in the assets and resources. And you call the private sector man, come and manage this for us. In private sector, we don't have the protocol of committee trying and trial all those things because we set out to make our profit. However, health insurance will be sandwiched in this situation. The providers must be paid for their services being rendered to the level of satisfaction. The capital flights should be reversed as much as possible. And our consultant brothers in the diaspora, including other practitioners, they must find their way back home. Please, can we work to Lagos State government for this initiative and innovation? That is not sound enough. Those of you who know me, if the soup is salted too much, you will see me right here. I will start showing resistance. I said this is 1+ for Lagos State government. Can we clap again? Yes. The only thing we should be ready for is that when things are alien this way, there must be some resistance. And the resistance must also be met beautifully with positive resilience. And after that's been done, we have to now arrest, encourage one another, and show facts and figures, let them be evidence-based. We're just starting. We need to educate ourselves the more. Our people must be well educated. They must see the gains from the pains. And we must also see the fact that we are becoming innovative. To the extent we're going to put on ground features, decisions, innovations that will say, Eureka, we find it. Honorable Commissioner for Health, when I look at the various logos up here, I saw all the subscribers, all the stakeholders. Yes, we are good partners. We will do the work together. As we go, criticism might come, we take it in good faith. On the demand side and on the supply side, we are one family. It is hoped we are going to beat this one very well. Thank you, and God bless you.
Another round of applause, ladies and gentlemen. Okay, what can I do to encourage all of you? One, I'm not a comedian. I'm not here to excite. I'm here to galvanize you towards ensuring that there's insurance for everyone. So what can I do to make you happy so that you can clap at least? So I need suggestions, please. What can I do? The hall is too cold. So can we just reduce the temperature a little bit? Oh, sorry, increase it. Which one is it? If you reduce it, it becomes colder. And if you increase it, it's warmer. It's okay this way. Some of you need to leave this country. That's what they are saying from this side. From this side, they said, okay, don't worry, we have doctors in this place. You are in safe hands. So can you give yourselves a round of applause, ladies and gentlemen? I like what Dr. Aribabu said. He said, look, for initiative as this, you find resistance, but it must be met with positive resilience. I think that is very commendable because when you have ideas that are laudable and very shifting. You have people that feel that well, I don't think we're due for this, but in that particular struggle, you need to have significant number of people that will say this is the way to go. And I guess that's where vision comes in. And thank you, Lagos State Ministry of Health. Thank you, Honorable Commissioner. Thank you for all those who are partnering with Lagos to make this work. Please, can you give yourselves a round of applause, ladies and gentlemen? Thank you. Thank you. At this point, I'd like for the last goodwill on for this first part this morning is the Managing Director, CEO, Aliko Dangote Foundation. Please make welcome Zoera Yusufu for her goodwill message. Can you make her welcome with a clap? Thank you very much. In case you didn't hear me, I said she's from Dangote Foundation. Aliko Dangote Foundation, you are not clapping. You're welcome.
This clapping that you want us to do. Yeah. Good morning, everybody. I'm just gonna rest on the established protocol already. Prof, thank you for the invitation. You can have I use this one. Okay. So I was saying, I will rest on the existing protocol that's already been established before me. Good morning, everybody. Good morning, Prof. Thank you for the invitation. And thank you for launching something that formally brings even closer together the private sector and the public sector. I think this is a good initiative. And of course, the Aliko Dangote Foundation, our primary focus is on health. And so obviously everything that you are doing that has to do with, private sector connecting with health is something that is relevant to us. And so we can't wait to see what the framework is about. We're ready to support, and you can count on us as always. Thank you very much.
Please, can you give her a round of applause, ladies and gentlemen? What better partnership do you require when you have someone who is also very visionary, a great philanthropist backing this? Please, can we give Dangote, Aliko Dangote Foundation another round of applause, ladies and gentlemen? Distinguished guests, ladies and gentlemen, I won't talk again about clapping again. Don't worry. We're working on making sure the temperature is convivial for a conversation as this. But in the meantime, I'd like you to pay attention to the screen because in the next couple of minutes, we'll be watching a video about understanding the Lagos Private Health Partnership digital platform. For those of you asking questions, for your indulgence to please pay attention to the screen for the next 5 minutes as we watch this overview video. Thank you very much.
Lagos, the city that never sleeps and never stops growing. In the fast-paced heartbeat of Lagos, healthcare doesn't wait. A city of over 30 million people, all with one simple wish: good health. Every second counts for patients, providers, and the people who keep the system running. But let's be honest, keeping up with the healthcare needs of Lagosians isn't exactly a walk on the park, or even a jog on Third Mainland Bridge. Our hospitals are full, our doctors stretch thin, the queues are long, and the paperwork never ends. And with fewer than 1 in 10 Lagosians enrolled in health insurance, it's clear our system has tried, but Lagos deserves better. The truth? No single sector can fix this alone. The government needs private sector efficiency, the private sector needs government vision, and the people of Lagos need both to work together. That is why the Lagos State government, in collaboration with forward-thinking private system where corporate organizations, HMOs, providers, and regulators connect in real time. We are bridging the gap between public vision and private innovation. It's where healthcare administration meets automation, where trust meets transparency, and where every single stakeholder finds one simple truth: efficiency saves lives. For corporate organizations, getting health insurance for employees has never been easier. Simply log in, select your preferred plan, make payments securely, and upload your employee list, all in one smooth process. No paperwork, no back and forth emails, just click, confirm, and care. And the moment your employees are enrolled, they can choose their preferred healthcare providers instantly. For HMOs, the platform delivers clarity and control. Corporate applications appear in real time, no waiting, no confusion. Approvals are seamless, and onboarding takes minutes, not days. With LPHP, HMOs finally get what they've been asking for: a single unified window into every partnership, every policy, every claim. When the enrollee visits a provider, care begins immediately. The doctor simply documents the visit in Integrated Electronic Medical Record, EMR. Because let's be honest, it's about time patient records stop being filed under somewhere in that dusty cabinet. Providers can now request authorization codes in seconds, receive approvals almost instantly, and continue care without delay. And when treatment is complete, it can be filed to any HMO within the LPHP consortium through a single interface. Vetting, approval, and payment all happen in near real time within 24 hours. For providers, that means less waiting and more healing. Regulators can now see key performance indicators across the entire ecosystem: live, transparent, and actionable. From enrollment rates to claim patterns, from service utilization to fraud detection, the LPHP platform provides oversight that drives accountability and builds trust. Because effective governance isn't about paperwork, it's about real time insights. LPHP isn't just another health program, it's a living digital ecosystem where corporates gain simplicity, HMOs gain visibility, providers gain speed, regulators gain transparency, and Lagosians gain access to quality care. In other words, everyone wins. It's the Lagos dream, powered by partnership, strengthened by innovation, and designed for every Lagosian. To His Excellency, Mr. Babajide Sanwo-Olu, thank you for your visionary leadership and for championing universal health coverage for every Lagosian. To the private sector, your innovation fuels this transformation. To HMOs, hospitals, and providers, you are the heartbeat of this partnership. To our multilateral and financial partners, your trust gives this vision life. And to the people of Lagos, your resilience and spirit inspire it all. The Lagos Private Health Partnership is not just a project, it's a promise that every child, every family, every worker, every Lagosian will have access to health, insurance, and quality healthcare they deserve. And who knows, maybe one day even your doctor's handwriting will be legible. Together, we are building a stronger, healthier, more resilient, and sustainable healthcare landscape in Lagos. Join the Lagos Private Health Partnership today and build a healthier Lagos for us all. Ìgbéga ìpínlẹ̀ Èkó, àjùmọ̀ṣe ni o.
I like the deliberate way at which you pronounced that last part. It was I've voiced it over and over again. So can we just recite it? Ìgbéga ìpínlẹ̀ Èkó. Ah, ẹ̀yin too complex here. I mean, let me come this way. I think Ìgbéga ìpínlẹ̀ Èkó. Okay, in case you don't know what to respond with, you say àjùmọ̀ṣe gbogbo wa ni àbí or àjùmọ̀ṣe wa ni? Àjùmọ̀ṣe gbogbo wa ni. So please, can we echo after me? Àjùmọ̀ṣe gbogbo wa ni. So when I say Ìgbéga ìpínlẹ̀ Èkó, you don't sound convincing. So can we be more convincing with this? I mean, Ìgbéga ìpínlẹ̀ Èkó. Thank you very much. We can speak Yoruba now. Thank you. Please give yourself a round of applause, ladies and gentlemen. Thank you. Now, I would like to crave your indulgence. For the first time, I will say bring out your phone. Please follow us on these platforms. On Instagram, you can follow us on LPHP_official. I repeat that again. On Instagram, you can follow us on LPHP_official. On LinkedIn, you have Lagos Private Health Partnership. Say that again. Lagos Private Health Partnership. That's on LinkedIn and on X, in other words, Twitter, at LPHP Official. Are we following, please? Because it's important that we do. There you find snippets of this as, the video we just watched on it as well. Thank you very much. I'll just go through that quickly. On Instagram, it is LPHP_official. On LinkedIn, it's Lagos Private Health Partnership. And on X, or otherwise formerly known as Twitter, at LPHP. Thank you for following. We appreciate it. Please, can you give yourselves a round of applause, ladies and gentlemen, once again? Can you give yourselves a round of applause, ladies and gentlemen? Thank you very much. At this point, we'd like to get some introspection. That's what I call it, an overview of health financing principles and insurance mechanics. And here we have someone who understands a frames and backbone of universal health coverage, health financing. Our speaker works daily to ensure that financing health in Lagos is not a maze, but a pathway. And she does it so well that many people now believe she can explain insurance to anyone, even in Lagos traffic. She has played a central role in shaping today's reform. Ladies and gentlemen, please welcome Dr. Fumi Deboje of the LPHP Delivery Office. And she comes to speak to us on collective financing for universal health. Please, can you make her welcome with a round of applause, ladies and gentlemen? Yes.
Right. Good afternoon, everyone. The hall has been a bit quiet. I think we need to charge the hall. And I hope my presentation does that. While it would be nice to stand on the existing protocol, as a public servant, it is a system I grew in, it's important you acknowledge your boss. So I will actually repeat the protocol to set the tone. I would like to start by appreciating the Honorable Commissioner for Health, the indefatigable Professor Akin Abayomi, the Chairman HSC, Dr. Mrs. Atinuke Onoyiga, Chairman Lashma, Dr. Adebayo Adedewe. Thank you for the opportunity in Lashma that shaped my life in its financing strategy. And I would like to also appreciate my senior bosses in terms of the PSCs, Body of Permanent Secretary. These are a group of people we look up to in the system. We hope to be like them in future. The directors from Ministry of Health, all specialists on health financing strategy present in the hall, the stakeholders, and all ladies and gentlemen. I would like to begin my presentation by setting the tone. It would actually give a context to what LPHP has to offer. So the topic is Lagos Private Health Partnership, a strategic vehicle for sustainable health financing and UHC in Lagos State. Is that working? Can you change the slide for me, please? Okay, it's working. Okay. So once again, my name is Dr. Fumi Adeboje, an health economics and health finances specialist. I'd also double as a senior technical assistant to Honorable Commissioner for Health. So setting the tone, we are here because every country, every subnational are in a haste to actually achieve UHC. What is UHC? UHC offers that everyone, irrespective of who you are, should be able to access the needed healthcare service in the quantity, quality that is required, and without the fear of suffering financial hardship. Why this statement is domiciled everywhere in the world? We know that all people are not equal. There are people that has the ability to pay for help, while there are some people that are struggling with finances, and some people don't even have the capacity. So government with the responsibility of being responsible for everyone, introduce UHC with subsidy, such that everyone with limited finance can actually procure it. Why some people without ability to pay for health finance insurance gets being covered under government insurance. But however, subsidy of health insurance scheme without compulsion leaves a gap that makes sure that individuals that have the ability or the wherewithal to register for insurance opt out of that scheme, because to them it's not compulsory. Why must I register for health insurance, especially if the quality is questioned? So health insurance with subsidy, it kind of open a system of healthcare system for only the poor, and when the quality is not taken into consideration. But at the same time, health insurance that comes with compulsion without subsidy force people to be in the scheme without taking consideration for the poor or people with limited ability to pay for that package. So Professor Victor, emeritus professor, stated this in his report that for countries and subnationals to be on a part of UHC, both subsidy and is equally as important as compulsion. That is what our system is lacking since the inauguration or the launch of National Health Insurance Scheme in 1999, and with another influence on the policy or law, we have a compulsory health insurance that was put into law by late and former president of Nigeria, President Muhammad Buhari. So far in Lagos State, what's the context like? Lagos State is a society of about 30 million people. If you look at its statistics, we have less than 10% of this population covered under health insurance. If you look at it, social insurance, which is majorly public finance, has all about 1 million enrollees, despite being mandatory since 2022. We are still struggling with numbers. Private health insurance, just a bit above social health insurance coverage. This scheme has been in existence before the advent of social health insurance. You can see the numbers is still struggling. We're able to achieve that because of labor law, which was corroborated by representative from NECA. Because employer encourage or ensure that employees are covered by a medical plan. So that means that we have about 28 million of Lagos residents uninsured. What happened to them? Because ideally, for a country to be on the path to UHC, you must have a strategic way of financing your healthcare. And if this group of people are not captured, that means majority of them are paying out of pocket. There are disadvantage of out of pocket payment. It takes away from it doesn't give up financial protection. It doesn't guarantee that quality is going to serve. And equity is actually questioned. So for a government, we have to ensure that all residents, irrespective of class you have, must be covered by a form of health insurance. But however, the National Health Insurance Act came out May 2022, which says everyone must have a base of social insurance before before a complementary or supplementary plan. And this is what National Health Insurance Act says, that a new era of financial reform was set up in Nigeria. It clarifies the relationship between the federal, state, and private operators, that social insurance must form the base of health insurance for all individuals in Nigeria. Thereafter, you can also now procure a supplementary or complementary plan from a private health scheme. So for Lagos State, we saw this new law or act as an opportunity to expand our scope of health financing strategy, and at the same time, taking us on the path of UHC. So what do? We domesticated that law to the context of Lagos State. And through the powers and approval of Lagos State Governor, he approved the issuing of Lagos State Executive Order 2024, which says that everyone is mandated and compulsory to be on social health insurance plan, where we have synergy within what the federal laws and the state laws says. At the same time, the executive order gives us power to enforce. If you can remember what I said in my intro, an health insurance plan or scheme without compulsion actually leave it to people not willing to comply, not especially it's going to shut out people with funds, rich people, because maybe there's issue of quality. It's going to shut out young and healthy individuals. But with compulsion and enforcement, the system is going to bring everybody on board and ensure that all individuals are captured, not only in numbers, but at the same time, we achieve the objective of UHC. So for Lagos State, we don't just sit down and think or expect others to lead us. We actually lead the way. We don't there's no option of doing nothing in Lagos State. Lagos State is kind of catalyst for the success of Nigeria. And we are blessed with fantastic individuals in all expertise to think about we're going to forge forward. And that's what actually birthed LPHP. So Lagos State did not wait for any design. We designed it ourselves. We are architects of reform, especially sector reform law. And Lagos State is setting history by ensuring that each initiative is going to be a turning point to the delivery of health financing strategy in Nigeria. So what is LPHP? LPHP is a kind of platform that brings synergy within the social insurance and the private health insurance. It's a kind of digital platform that promotes all private insurance plans into a coordinated system. So far, till now, we have private health insurance scheme. It's a scheme on its own, where HMOs are the players in that scheme. There are pockets of plans that speaks to different things, and they don't achieve common goals. What LPHP is trying to achieve is that all HMO, in this case, is not compulsory. We are not the regulator, but it's a state policy that ensures that health system in Lagos State is channeled towards UHC. So we bring together all plans within the private scheme. We standardize it, we coordinate the operation to achieve the government goals of UHC. And at the same time, because this private insurance scheme are fragmented, it defeated the objective, what we call redistributed capacity of common pool. So what LPHP is going to do is that it's going to create a kind of integrative pooling among all these HMO plans, such that funds can be assumed to be in one post, which is the same thing as having a unitary pool. At the same time, let me say this. Okay, this is the second slide I'm talking for too. So that PHP pool platform is going to create a unified platform for all private health insurance schemes. The platform is going to serve as a strategic platform for purchasing. One important factor that's actually inhibiting us be on the path to UHC is lack of strategic purchasing, because these HMOs are scattered They create a different platform that is being utilized at the healthcare provider level. So we brought about a unified platform where purchasing and transaction and operation of health insurance activity takes place on that platform. For us at the HPHP, we look at all activities that is going on at the hospital level, at transactional level, such that we can actually devise an informed decision and form policy direction for Lagos State. Using the platform brings about transparency and improve efficiency. At the same time, what HPHP their initiative is supposed to do is we're also looking at a sustainable way of generating fund for the system. Though public financing is the backdrop of UAT, but it comes with its own challenges. Sometimes it's not feasible. What you projected is not what you have. Government can have some other demanding or pressing issue where they give little to healthcare. But the system is going to operate in such a way that we are going to affirm the objective of unified pooling. Assume you have a unified pool where everybody pays into a pot. But for the platform, it's going to extract a certain percentage of the premium into a government pot. This expands the fiscal space for government, and government has enough funds to do other public service that supports the entire system and majorly the public health insurance scheme. At the same time, just like Chairman Etsipana said, or LPHP is actually creating access to quality services. If you remember that, even if a subsidized insurance is marketed, if there is no quality, people will not buy into it. If they buy into it, they might drop off when the experience is not good. We are going to ensure that there's going to be quality improvement and assessment. HC has said it in his opening remarks. A farmer is a strong stakeholder in this journey. We are going to ensure that people, or organizations that participate in this scheme maintain SOP. We also are going to improve the capacity to deliver quality of healthcare services. One thing, okay, I've discussed this. One particular principle LPHP is going to address is fragmentation. Fragmentation is a barrier to achieving UHC. It does not bring about cross-subsidy that has to do with risk subsidy in terms of elderly people and ill people belong to the same pool. This is LPHP platform is going to give us that. It's going to bring about subsidy of the rich subsidizing the poor. By contribution from HPHP consortium of plans, it's the subsidy that's been, the fee that's been deducted is going to fund activity of the social health insurance scheme and generate the public health services. And at the same time, when everyone is partaking in health insurance, it's going to ensure that people that are young and active due to compulsion are ensured to be within the scheme. Not only when you are old or without a job. And because of that, we are actually overloading or giving our social insurance scheme kind of adverse selection, which is not good for the scheme. But for HPHP, we are going to bring all this together through enforcement of the law that both young and old, both the young and old partake in the health insurance scheme. So what are we talking about solidarity in health financing strategy? Usually, the brain or the concept behind that everyone must be in a scheme is that I might not need an health insurance, I might not need health care. It's for now, but I'm contributing with the hope that I'm supporting somebody else that needs care. That is the concept of risk equalization. Because we cannot have the private sector, which has larger form of rich people, young and active people, to be in the same pool of public health insurance. And by deducting a certain fee of this, their premium, under the platform, that will go into a pool serve the function of risk equalization. In as much you cannot achieve a unified pool, a flow of fund from the private health insurance flows into the social health insurance or and the general public health space to act as solidarity for the health system. What some people might ask, why am I playing solidarity to the health system? Part of everyone is important to the economy. The fact that you are not seeing it, it might be an indirect experience. Your staff being healthy and be able to come to work as I went due to do his tax is supporting the economy and the output of your organization. So that feeling of solidarity is very important. Not that we wait until everyone needs an appeal to seek for health care at the hospital. That is a form of out of payment funding. We are not trying to encourage that. But through solidarity, where your premium, a bit of it is being set aside to support the social health insurance scheme, is what we are craving for. So, how does the LPHP support strategic purchasing? By providing a unified platform. This is one thing healthcare providers have asked for, because up until now, the healthcare facility are burdened by several platforms from various HMO. That increased their administrative fee, that increased their efforts to ensure that they deliver on the task of treating the patient. But providing a unified interface such that whether you are interacting with HMO A, HMO B, all transaction and operations happen on that platform, because all the benefit package, the cost of each care, the details of each plan are on the platform. So transactions are transparent. It eliminates bottlenecks. Sometimes you might need to call because some focal officer or desk officer of particular HMO. Sometimes it's difficult to reach them as I went you. But using interfacing with the platform, that's take out the barrier of delay in giving our patients adequate care. At the same time, because transaction and approval are easy, it's going to bring about faster patient care. It's going to reduce waiting time and claims delay. And one thing the platform is also going to do is that it measures the response time of HMOs within the consortium, how you respond to queries or complaints from the healthcare provider, because these are the things that make delivery of healthcare services difficult. So at the same time, because all transaction and patient care is on the platform, we at the delivery office can actually have data to support the system. We can actually track how healthcare provider make decision on patient care. Do they do unnecessary care or services or operation? We can track what is happening. We can even track antibiotics use. We can track a lot of things that inform the outcome of a good healthcare system. And at the same time, standardized contracts instead of multiple hospitals signing multiple contracts. By being on the platform, there is a single document SLA that needs to be signed by partners at the same time. So we don't have to have multiple contracts with multiple HMOs. So one important thing, a cry of healthcare provider is that most of the packages being sold by HMO are not adequately costed. And that contributes to the level of funding that goes into the health facility. And that also translates to how they deliver care. It translates on how they can source for human resources for health. What the platform or the initiative is going to offer is that there would be adequate actuarial costing of health benefit. There will be standardization of the packages. There will be appropriate costing that reflects the economic status of the country at that point in time. We are going to ensure that the patients receive value for health, because to everyone, irrespective of who you are. We are not building a health system alone for the poor, while we are not making life difficult for the private sector. Thank you.
Ladies and gentlemen, she deserves a better round of applause, ladies and gentlemen. I hope with a few points of hers, you understand LPHP. Once again, can you give her a round of applause, ladies and gentlemen? Thank you very much, Dr. Fumi Adeboje, for that insightful overview of health financing principles and insurance mechanism. Distinguished guests, ladies and gentlemen, I'd like to make a detour once again, and this for the aesthetics of this particular event. Let me tell you, media is very important in what we do. Now, while I was seated at the back, the media people came to meet me and said, we cannot take any picture now because the hall is parted. So I want to crave your indulgence. If you are seated at the back, please can you move forward? Let us make it concise. Let us make it more presentable for those who are out there. So please, or better still, can I have the ushers? Can you just help them move forward? Don't worry, we've reduced the air condition because you're approaching towards the light. That is not where the vent is. It's this way. I can't see movement. I need movement, please. Thank you. Please, can you help us occupy the spaces in front of you? I'll give you a few minutes to do that. Let us do that. The ushers, can you help me? Thank you. Thank you very much. Now, because I said you should occupy the front, the spaces in front, I didn't mean you come and sit down where the governor is going to sit. That is not what I'm saying. I mean, just occupy. If you see a space in front of you, occupy it. If there's any need to make adjustment, we will apologize to you. I can still see some people seated at the back over there. Please, can you move forward? Please move forward. Madam, thank you. Thank you very much. We appreciate you. While Dr. Adeboje was speaking, someone that I respect so tremendously because he's visionary and he's also very astute. If you listen to him, you understand the depth of his wisdom and understanding. He's also keying into sustainability a lot. Please make welcome the MD CEO of Sterling Bank PLC, Mr. Abubakar Suleiman. Thank you very much, sir, for being here. We appreciate you. At this point, I would like to, before we take the next video, I'd like to tell you we'll be having a panel session. I want to crave the indulgence of all the panelists. We're expecting a visitor today. And if during the course of your panel session, he walks into this building, we're going to halt it. So I'm just giving you heads up ahead of time. So after this video, we'll be having a panel session where we'll be looking at a critical dialogue with leaders across the health ecosystem as they share perspectives and explore solutions for financing health in Lagos. At this point, I'd like you to pay attention to the screen as we watch a video on the impact of the revised health financing ecosystem in Lagos. Please, for the next 5 minutes, I will pay attention to the screen. Thank you very much.
In Lagos, healthcare has always been powered by resilience. From the nurse who begins her shift before sunrise, to the doctor racing between patients, to the families who rely on a system that works twice as hard as it should. But now, something extraordinary is changing the story. The Lagos Private Health Partnership, LPHP, is transforming healthcare from the inside out, quietly, intentionally, and at a scale never seen before. It's more than digitizing hospitals. It's about giving every provider the tools to work smarter, not harder. It's about shifting our system from reactive care to proactive, data-driven health for all. LPHP is helping turn our brain drain into brain gain, building systems that keep skilled professionals here at home, while attracting global expertise to Lagos through technology, remote collaboration, and modernized workflows that match global standards. With modern tools, seamless collaboration, we are creating an environment where talent doesn't just stay, it thrives. HMOs and providers now operate with more transparency, faster payments, and fewer disputes. Hospitals regain time that once disappeared into paperwork and can redirect it back to patient care. And here's an impact many won't notice immediately, but will feel more doctors on duty, cleaner facilities, working equipment, shorter waiting times, and even more affordable care over time. Healthcare stops being a burden and becomes something that works for the people, not against them. As waste reduces, efficiency increases, and resources stretch further, providers can invest in quality, staff training, equipment, and stronger patient outcomes. LPHP is building a system where quality care doesn't come with the price of financial catastrophe. By streamlining payments and integrating insurance, we are directly reducing the crushing burden of out-of-pocket expenses that push households into poverty. For Lagos, it means a more resilient health system, one capable of delivering equitable care to millions without collapsing under pressure. This is more than a program. It is a promise, a commitment to a healthier, more financially secure Lagos. As the foundational architecture for universal health coverage in Lagos, LPHP will enable the state to achieve measurable results. A 70% insurance coverage rate within the first 5 years, a 30% reduction in catastrophic out-of-pocket health expenditure, a sustained increase in the health sector's contribution to Lagos GDP, and the reversal of professional brain drain through viable economic incentives for health workers. In doing so, Lagos will not only fulfill the spirit of the NHIA Act of 2022, but will set the gold standard for subnational implementation. A model of cooperative federalism, fiscal prudence, and social equity.
Please, can you give a round of applause for Lagos State Government? That clearly outlines what LPHP is all about. Distinguished guests, ladies and gentlemen, at this point, we'd like to have the conversation about the future of healthcare financing in Lagos. I'd like to invite the panelists to the podium, and after that, I will hand over. Investments. Thank you very much. You're welcome. Please, I'd like you to put your hands together for Injide Indile Farm Access Foundation. Thank you. And from Sterling Bank, Mr. Obinna Ukachukwu. Please, can you give him a round of applause, ladies and gentlemen? And At this moment, I'd like you to put your hands together for our moderator of this panel session, Mr. Femi Kingbade, Executive Secretary, Health Federation of Nigeria. Can you give him a round of applause, ladies and gentlemen? So the conversation in the next couple of minutes will be about stakeholders' perspective, the future of healthcare financing in Lagos. I now hand over the mic to our moderator of the panel of the session. Please can you give him a round of applause? Thank you.
Thank you so much. Thank you so much, MC. I think I've been saddled with a very big task today because I look at the panel and I told them that I seem to be the smallest on this panel. And at the same time, I'm supposed to be moderating the panel. We are here today for something quite significant, and we're all aware of what Lagos State is trying to do here today. Lagos State, just like has been highlighted by a lot of the previous speakers, actually has a big role to play. Number one is the economic hub of the country at this time. But at the same time, Lagos State is also saddled with so many things. I tell people, I said Lagos State is about the only state that doesn't have rural areas. Almost everywhere in Lagos State is now becoming urbanized, and you find out that the amount of people that are well educated, even those that you think are artisans, is increasing by the day. And Lagos State is the only state that is taking in migrants of almost an average of like 100,000 people coming into Lagos on a daily basis. This is also bringing a big strain on the health system in Lagos. There's a lot of inequality. There's a lot of things that Lagos State has to contend with. And because of that, today we are actually here to look at the future of healthcare financing in Lagos State. My panel here today, I'm sure that if I leave each and every one of them to be able to speak on this topic, there will be a lot of time that we cannot cover up for. So many things look as if they are the problem now in Lagos, and that is why we need to come together like this at a time, come and look at what we can actually do to make healthcare financing, one, sustainable, two, to make it affordable, and then to make it inclusive in Lagos State. I have on the panel this morning, I have Mr. Olusonya representing independent health maintenance organizations. Obina is also there representing our funders. We need a lot of money. And the health industry is one of the industries where the banks run away from most times because we don't have collateral. A lot of us are still running the mom-pop organization whereby we don't even have the structures to be able to access this financing. And then we have Dr. Mrs. Folala Oye. The journey has been a long journey. And she has been in this journey for a while now. Thank you so much, Dr. Laoye, that you are not tired yet. I know you've talked about this so many times, and today will not be an exception. Mr. Tosin Awoshika, you've been on both sides. You've been on the private side. You've also been instrumental also on the public side. And I know that your knowledge here today is something that is not going to be discounted. And of course, the last but not the least person on this panel, today I'm sure she's wearing like 10 caps, not even two. She's standing here as the country manager for Farm Access, and also as my president of the Healthcare Federation of Nigeria. So you're welcome, Njide Ndili. Very quickly, without wasting so much time, I want us to just go straight into why we are here today. And I'm going to start from the bottom of the ladder. A lot of times, what actually puts off a lot of people, especially the providers, is that they often face unpredictable claims cycles. We've talked about fragmentization today. A lot of our payment structures are fragmented. I was trying to analyze with somebody this morning. I said in Nigeria, as of today, we have 36 plus one different benefit packages run by the states. If we start to add the ones that the National Health Insurance Authority is also operating, it takes us to almost like 40. And then by the time we are adding almost like 80 to 90 other plans run by the health maintenance organizations, we'll probably be looking at upward of like 150, 160 benefit packages running in just one country. Dr. Folalawi, I think I'm going to start with you. Because a lot of these providers, what they face is actually discouraging them from actually participating in this health insurance that we're talking about. From your perspective and from the operational experience that you've gathered over the years, and now that you are now running the Wilson Group of companies, what reforms do you think, for us, especially in Lagos State, what reforms do you think Lagos State can bring in to improve the provider and the relationship with providers? What reforms do you think they can actually bring that can guarantee service availability and also provide good liquidity for these providers that we're dealing with?
Good afternoon. Thank you very much. Well, all protocols observed, and to Prof, Honorable Commissioner, congratulations for bringing us all together. I think this is a real first for all of us. Obviously, Lagos is always the home of many firsts, but certainly having convening and creating a platform like LCHP is very much laudable. Thank you. Thank you for the question. And perhaps I will try and take it from perhaps just two aspects, what I'll call the provider situation. Certainly, on the one side, is what I'll call the inputs to the provider. Now, the providers being our hospitals, our clinics, at the end of the day, really want to do one thing, which is to look after their patients, look after the population, the community who come to them. But to do so, they need some predictability. We need predictability in terms of knowing who our community is, being able to identify them, being able to predict the type of care we need to give them. And therefore, identifying them is very important to us. But second, and as important, is also being able to predict our cash flow. How much do we have? How much do we have on a sustainable way to really be able to look after them when they come? First of all, they come for a variety of issues. And like I said, that's why it's good to be able to predict when they are coming or what they are coming for through identification, through the data that is important to let us know what sort of diseases are they likely to present with. But as I said, cash flow. And I think that's what Mr. Akingbade spoke about when it came to claims. How can we make sure, even though we are working with a myriad of payers, whether it is people paying out of pocket, whether it's the different HMO platforms, whether it's corporate payers, how do we really bring all this together to be able to understand this is the cash, in the system that sustains paying for services, paying for salaries, paying for drugs, paying for everything that needs to be paid for, paying the banks to be able to deliver this care. Certainly in our system, because now we have a few different hospitals that we oversee, we see different systems of uploading claims. Every month or middle of the month, it is a real task to upload claims to this HMO, to that, to send bills out, and so on. So being able to really collapse that and create predictable cash flows is very important. But maybe the last thing I'll talk about is the other side, which is the outcomes, the output. How can we really ensure that we are giving a standardized output and outcomes of care? Who's measuring that? What is quality? How do we really think about the quality of care and ensure that what we're giving on the other side is standardized? So that way, whatever we put in is giving us a good outcome. And I think that outcome is as important, even as we think about the cash side. It's as important that the clinical outcomes themselves are measured, are standardized, and are also beginning to be used in a way to inform what the inputs are. So it's a virtuous circle, if I can call it that, not a vicious one, a virtuous one, if we get it right. Thank you.
Thank you so much. Let's give a round of applause for her there. I will move directly to Mr. Tosin Awushika, because all what we are discussing here today, we've talked about what we need to face. And just like Dr. Larry said, there are two main people that you need to worry about, or two things you need to worry about. You need to worry about the clients. You need to identify them. You need to understand what their needs are. You need to understand where they are coming from. Also, in terms of the providers that are available for them to access care. And then at the end of the day, you need to be able to maintain the cash flow that are coming to these facilities. For you on the government side, Mr. Awushika, there are a lot of price now, because if you look at the population that we have in Lagos State, we say about 75% of them are in the formal sector, because I call them formal. You think they are informal, because a lot of these people that you classify as informal also, they have formal associations. Even the artisans, they are more organized, even more than those of us that think we are formal. We have a large population of these people in the informal sector. What efforts are you making to even cover those people that seem to fall under these medium, small enterprises, and also those that are under that informal sector arrangement? What exactly are you doing to be able to take those people in? Because insurance will not succeed until everybody is on board. So what efforts are you making for that sector of the population?
Thank you very much, Femi. But let me first of all also thank you for letting the scene going on for this event. And we know that it's been a long journey, so it's for what you have done today. Most of the people I know with, because you talked earlier of me being on both sides, they're not represented nowadays. I deal with in a very scarce yeah, in the informal sector. But like you also said, there's also a lot of formality what's about that. And what is key the most is that we have very, very fragmented set of people. Because even okay, the thing about most of these associations too, we must realize that they are voluntary. Membership of these associations are voluntary, even as much as they try to make it compulsory for them. It's up to whoever is joining that's joining. And at the end of the day, what we've been trying to do is find a way in which we can pull the various resources that they have together. A lot of them are what you call daily paid. They earn their incomes on a daily basis. And unlike the formal sector, it's very difficult for them sometimes to pull all of these monies together to pay their premiums, you know, and we still need to be able to bring them on board. So we've come up with quite a lot of ideas. We've done the route of getting them to pay their premiums at once. It hasn't worked. So we've come to getting them to pay small. It hasn't worked because all the things you find about most of them is that they come only when they need care. I mean, if they need care today, then they struggle to buy the social health plan, and the more they get the treatment they want, they get off. That's if they're paying small. We've come using other routes. Looking for ways in which we can form them into cooperatives, as it were, groups whereby we have some form of financial inclusion, whereby we get people to be responsible for the payment of the premiums. That, of course, is not taking away the fact that government on its part is also responsible for some of them because, under the Lagos State Health Scheme, we have the operating fund, which is actually a percentage of the consolidated revenue of the state. And this is used to fund those that are classified as vulnerable and also fall into this informal sector group as well. So we also have those that we encourage, to buy plans that would sustain them. In Lashma, we have about 3 different plans, for these various groups of people. So when you are counting your 1, 2, 3, you actually assume that there's only one plan in the states. A lot of states have more than one, so you actually have to deal with that. So we're making a lot of effort. It's not a magic wand. The informal sector has always been a difficult place to crack, and as long as these pools remain fragmented, it's going to be very difficult, to get them. But I believe that, as was said earlier, the NHIA Act makes it mandatory for everybody to have social health insurance. The executive order makes it mandatory for everybody to have social insurance. So I believe that with enforcement, which was one of the things Commissioner also talked about, if we are able to mandate and implement that so that everybody wherever you are, be you in the public sector, be you in the private sector, if everybody is able to pool resources for us to enforce that so that at the end of the day, if I mean, I always say it, imagine if 20 million Lagosians are on the social health plan, then none of the problems Fola talked about can be taken care of because we now have a fairly large pool of funds which will enable us reach out to all of those people. So whether you are visiting a public facility or a private facility, you will be able to access funds. Then, of course, as the NHI Act says, which again is enforced, provided for in the EU, if you now need supplementary plans, you can then get whatever plan you want to get. And I think that's also one of the things that the LPHP aims to do. I think I'll stop there.
Thank you so much, Mr. Ushika. I will still come back to you because there's an area there that I know that you touched very succinctly and ran across it, but I will still come back to you. I want to take it up from here. Opener, there's a lot that has been put on the table now, and one of the things that I mentioned initially is this issue of funding. And you can actually see it coming again from what the states are trying to do in terms of ramping up the insurance coverage. They've tried to make people pay upfront. It has not worked. They've tried the pay small. It has not worked. They've tried association model. It has still not, it's not optimal. Don't let me say it has not worked. It is not optimal. Now you are standing here as a funder, and I know there's a lot of CSRs that you do at the end of the year that are running parallel, but sometimes, let me just use that word, are not as effective as you wish they could be. Is there any way, as you stand as the funders, to see opportunities in what is going on now, and then now strategically position yourself to be able to bridge that gap, knowing that you will get your money back after every other financing options have been deployed? But we need somebody that can stand in the gap for now to be able to take up this enrollment and then structure payments at the end of the day. Is there any opportunity in what you are seeing now in Lagos State for you as a funder to be able to come in and utilize your CSR properly?
Thank you very much. Thank you very much. I usually like starting this kind of conversation or response by saying that healthcare is not, it's a social good, but it's a business. It's pure play business. And when it's not seen that way, it can't be sustainable. So usually when people talk about healthcare and they put it, those are the private sector people clapping. Well, usually, and I deviated a bit, but usually when you talk about healthcare and the next thing coming after it is CSR, it sort of colors it a little bit. It's a it is going to make next month. You don't know whether the creditors are going, the debtors are going to pay. And one thing that has caused this, especially in in our system is, if you trace back when the whole health insurance industry was getting up in Nigeria, we used to have this mandatory capitation. It was like you had to select a provider, and whoever is covering you will capitate you to that particular provider. So then people had their primary care physicians, and there were a lot of things that went wrong. That they said, oh, the quality of care was poor, blah blah blah, and we now innovated, and everything was like fee for service. And fee for service actually took away the predictability. I think that one way we can innovate is to go back and say, hey, where did we miss it? Because if you've got providers in the scheme that are in your social health scheme or social plus private, I call them together, there has to be this base level that when someone funded looks and says, oh, you've got 20,000 patients, it means that this is the base you would always make every month. I think there's a blend. We can actually find that blend, and this is the private health care players here. We can find that blend where the individuals become capitated. We capitate them again to these providers, and usually it's driven by corporates that say, hey, we want 20,000 hospitals and the rest of them, but we've got to follow some structure. That would help with transparency and predictability. And immediately when you have predictability and transparency, funding will go into the system. Think about what happened during COVID. There were very few laboratories that could do certain kinds of tests in Nigeria at the time. When COVID happened, we knew that, hey, we needed the capacity to do testing in the country. Funds did not just go directly to the labs because, hey, funds go where it could be repaid. Immediately the government came together to say, hey, we're consolidating this thing. We want to ensure that people can, we want to control, we want to pull this thing together to the center. The funders knew that, hey, the labs would get paid. It's no longer opaque. And funding went to the places, the people that provide these services, and people upgraded their systems. They were able to pay for, the system paid for itself. Now, if the government didn't come together to put that together at the time, COVID would have come and gone, and we'll still have the low-level labs that we had. And you wonder, where did all the money go to? Where is everything? It's because when things are, what's it called? When they're in fragments, you never see their value. I'll close this by referring to a Bible story, you know, the 5 loaves of bread and 3 fishes. And when the people had eaten and they were full, and the master said, oh yeah, gather the fragments. They gathered the fragments and saw that they had 12 freaking baskets full. That's exactly what's happening in our health system today. The money's being spent, but it's not making meaningful impact because it's just spent in fragments. And what the government is doing today is that they're pulling everything together. It's not just me, probably because we have a little bit more foresight and we take a little bit more risk. We're here today. Tomorrow, in the next 6 months, in the next 1 year, you'd see funders stumbling over themselves to be part of the central system because they know that this can afford it can afford itself and it's sustainable over time. Thank you.
All right. Thank you so much. And I'm happy that at least you were able to generate applause from the crowd based on what you said.
For my party members.
Yes, I know they are from the party members. I'm still coming back to you because you actually mentioned something now, which is part of what I mentioned at the initial goal. And this is the area of consolidation, especially in terms of providers. Probably that will build a lot of trust in people when we are coming not as fragmented, because I told somebody this morning, I said, even within the medical sphere, the number of associations we have fighting for almost the same cause is intimidating. And you see GUSU today going on strike. Tomorrow you see Association of Senior Staff. Tomorrow you see resident doctors all fighting for the same cause. Incidentally, I'm coming to you now. I shouldn't be directly asking you this,
but I will do that. As like I said, you're wearing two caps, but I want you to put on the one for the Healthcare Federation of Nigeria at this time, because you sit on a coalition of private healthcare providers, which is the biggest that I know now in Nigeria. Obina said some things, and it actually stems around a misalignment between the public and the private investors or initiators. Let me say there's a collaboration that should happen between the private sector and the public sector. But we realize that we've been on this thing for a long time. There's a big misalignment between these two factors. Now it's quite obvious that the funds are dwindling, as in international funds are dwindling, and now we are faced with the fact that we need to look inwards, especially in terms of mobilizing domestic resources. As president of HFN, one, I want you to clear out why do we have that misalignment between the public and the private, and then secondly, what can we do better to actually bring this synergy that Obina is talking about, to be able to speak on behalf of the network, especially when it comes to accessing finances or funding either on the demand or the supply side. Thank you.
That's a very loaded question. And unfortunately, some of the people that need to hear this briefly stepped up. So the first thing is that there needs to be clarity of role. The government really should be leaning more on the regulatory side of things, creating an enabling environment for private sector to support their initiatives. Yes, you talked about the reducing ODA. Why was there ODA in the first place? Because there was a huge gap in the system which donors came in and filled for us. I mean, this has happened for a long time that we took it for granted, ignoring that we need to grow our own private sector to take up that role. Now that the ODA has, is fast depleting, I'm happy there's now a focus on private sector. But then again, how are we allowing private sector to thrive? If I take the example of the National Health Insurance Authority and the mandatory health insurance schemes, you find that it's skewed towards public sector. Public sector has the hospitals that are being used. Public sector is focused on, the government health centers, the tertiary hospitals, and so on. There's little encouragement, I would say, to create an environment where private sector will thrive, that would attract investments. So from the Healthcare Federation point of view, what we've been trying to do is really to aggregate the voices of the private sector. Sorry. To aggregate the voices of the private sector so that we align our voices, showcase what we can do, but also at the same time highlighting to government where they need to support private sector to thrive. So, for example, since I've been involved in the Healthcare Federation, I think we've written at least maybe 8 or 10 position papers to government. One is there power? How come private sector, they have to run on gen? There's no way a hospital can be sustainable running on generator. That's one. Is there a solution that can be proffered where, there's maybe an independent power plant that government and private sector can tap into? That's one. Two is, the PPPs. Government, the first government comes in, the first thing they do is they build a new PHC. Meanwhile, we have PHCs littered all over the place. Is there a possibility for private sector to support that? Three is in terms of alignment of quality systems, accreditation. What is the state they ensure that they provide some clarity around roles? How do they ensure there is predictability, as my co-panelist mentioned? Because they can't attract investment when one contract has been issued, the next government comes and yank the contract away. Meanwhile, the private sector has invested so much. How do we ensure there's a steady pool on the demand side that would, utilize the supply side, which would then attract investment? So really, from the healthcare regulation point of view, is aligning some of these issues, offering solutions, not just complaining, but putting down proper recommendations that the state can adapt, and then working with government to co-create, co-design. I'll give one last example. I was just at the joint annual review last week in Abuja, where the sector-wide approach, where everything was being reviewed. How did we basically a scorecard, and I had the unfortunate law to be brought onto the panel. I wasn't there before. It was really to launch some of the guidelines and action plans that have been developed for next year. And I'm sitting I was called up last minute. I was sitting on the panel, and I whispered to my government co-panelists, "What are we launching?" And he mentioned to me there were about 4 reports. And everybody went on, talking about how excellent the report was and all that. When it got to my turn, I just couldn't lie. In the presence of the minister, I said, "Sir, never seen this report before. This is my first time of seeing it. If you want private sector to be a co-implementer in some of these reports, then please bring us to the table." But having said that, it's a good report from what I've seen. But please, when we're about to revise it, invite us. The rationale is, there's so many private sector entities, and we don't know who to talk to. Now you know who to talk to. We try to represent all the voices. I'm not the expert, so when HFN is called, depending on the subject, we bring the right experts to the table. So having said that, I think this is a good initiative. Private sector is here to stay. It's for us to have a permanent seat at the table, be part of co-creation, bringing our solutions, bringing our ideas, bringing our money, our transparency, efficiency, and so on and so forth, to support what is being done. Ultimately, I think we will all benefit from the inputs that we bring to the system. Thank you.
Thank you so much. Please, let's give a round of applause for Ingrid Ndulabura. There are so many things that she has mentioned. And one of the things that I think I've had like 2 or 3 people mentioned it here today is that when the private sector comes, they actually bring in a lot of efficiency, they bring in a lot of innovations, and so many other things like that. Mr. Olusoya, I'm coming to you directly, because there's been a concerted effort to harmonize the federal and the state government, especially when it comes to health matters. You hear some people say health is on the, I don't know whether it's concurrent or exclusive or this, and then there's this disharmony between the federal government and the subnational governments people in terms of how do you implement what is coming up, what is coming from the center at the subnational level. Now you are seated in the middle of these 2 bulls or 2 elephants that are just raging. Because as a health maintenance organization, you are supposed to be the third party, even in achievement of this universal health coverage. The law has come out quite clearly, the areas of jurisdiction for HMOs. Don't go to basic healthcare packages, sell supplementary, sell complementary, blah, blah, blah. Now we are here launching the Lagos Private Health Plan. And if you look at the plan very well, the health maintenance organization happen to be the fulcrum of this plan because they are in the middle. Everything that has been said here today looks as if it's revolved around HMOs.
You are the ones that are to sell, you are the ones to purchase, you are the ones to do so many things. But somewhere in the middle, the health maintenance organization are still finding it difficult to place themselves strategically in this partnership. What do you think can be done differently? Or what are fears that needs to be allayed to make sure that this works? Everybody here has spoken, and one of the things that I hear clearly is that we need to start. Without starting, we'll keep complaining. We need to start. How do we start? And what are the roles that you will play, especially in Lagos State at this point in time? Thank you.
Very much, Mr. Akibade. So I speak here today as an independent consultant in healthcare financing for 2 decades. And from what I've seen, I think it's time for health insurance to partner with government at each state and also with the NHIA. And that's what the Help HB is about. One of the major challenges has been how to find a way to standardize offerings that HMOs bring to the table. A lot of HMOs want to be very individualistic. They want to differentiate. They want to appear unique. And without proper regulation, transparency, standardization, ethical pricing, proper ethical pricing, where pricing is the input.
Ladies and gentlemen, distinguished guests, please can we be on our feet? So welcome the Governor of Lagos State, Governor Babajide Olusola Sanwo-Olu, ably represented here this afternoon, and the Secretary to the State Government of Lagos, Barrister Abimbola Sani-Ogundoye. Please can you give her a rousing round of applause, ladies and gentlemen? Well, welcome, Mr. Governor. Thank you very much for being here today to support us as we start this journey for Lagos Private Health Partnership. Please, as we're on our feet, can we please take the national anthem, the first stanza. Thank you very much.
Nigeria, we hail thee, our own dear native.
Thank you very much. Can we have our seats, distinguished guests, ladies and gentlemen? Mr. Governor of Lagos State, you came in when we were having the panel session for the launch of the Lagos State Health Financing Reform featuring the Lagos Private Health Partnership. At this point, I would like to establish protocol before we continue with this event. The Governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu, ably represented here this afternoon by the Secretary to the Lagos State Government, Barrister Abimbola Sani-Ogundoye. Please, can you give her a round of applause, ladies and gentlemen? Members of the Lagos State Executive Council here present. Of course, we have the Honorable Commissioner for Health, Professor Akin Abayomi. Also here with us is the representative of the Special Advisor to the Governor on Health, Dr. Mrs. Kemi Ogunyemi, ably represented by the SSA to the SA on Health, Mrs. Sarah Balogun. Chairmen of statutory commissions and members of board, We have here with us Chairman, Health Service Commission, Dr. Atinuke Onoyiga. Please, can you give her a round of applause, ladies and gentlemen? We also have here with us the chairman, LASTMA, Dr. Adibayo Adidowo. Please, can you give him a round of applause? Thank you for being here today. We also have here with us members of the body of permanent secretaries here present, directors in the health family here present, top functionaries and heads of ministerial agencies, captains of industries, Managing Director, CEO of Sterling Bank PLC, Mr. Abubakar Suleiman, you're welcome. Senior Vice President and Chief Corporate Services Officer, IHS Towers, Mr. Dapo Otula, you're welcome, sir. Director General Employer, DG, National Employers Consultative Association, Dr. Wale Smart Oyemide, ably represented here this afternoon by the Director of Legal, Regulatory and Taxation, Mr. Thompson Apabio. You're welcome, sir. We have here with us the MD CEO, Aliko Dangote Foundation, Mrs. Zuera Yusufu. Thank you for being here. Health development partners and stakeholders here present. Public and private health practitioners, members of the health family here present, distinguished invited guests, gentlemen of the press, ladies and gentlemen. Having done some form of introduction before, I'd like to do that again in terms of saying it is a pleasure on behalf of the organizers of this laudable landmark event. I warmly welcome all of you to today's epoch-making event on calendar, which is a turning point. In Lagos, we say Igbega Ipinle Eko Ajumosheni. And this afternoon, we gather to witness a promise kept, a commitment renewed, and a future reshaped. For years, we have spoken about access, we have debated affordability, we have hoped for a system where every Lagos resident, from the artisan in Ikorodu to the entrepreneur in Lekki, can walk into a health facility with confidence and walk out with care, dignity, and peace of mind. Today, that road becomes a policy, that policy becomes action, and that action becomes life-changing. Please, can we give ourselves a round of applause, ladies and gentlemen? Once again, my name is Joshua Akimbola Murakio, and it's a pleasure to be the compere, and of course, I am a broadcaster as well. We will continue with the panel session, but I've been told that we need to give them 5 minutes, Mr. Governor. So we have a panel session when you came in. They're speaking on the key aspects of financing, private health financing, as well as how to get the aggregate number of people to partner to get this moving forward. So in the next 5 minutes, hopefully they can just wrap up this conversation and we'll continue with the program. Thank you very much. Please, can you give yourselves, ladies and gentlemen, a round of applause?
Thank you so much, Mr. MC. I think 5 minutes, we will try as much as possible to get there in the next 5 minutes. Mr. Lusoya, you were just explaining something just before His Excellency came in. Go ahead.
So I was talking about the need for insurers to come together to have a framework for standardizing offerings that will be available on the health PHP. And this has been a challenge over the years because lack of professionalism, medical pricing that led to a lot of price war, road to the bottom pricing, and destruction of value. Because you create value when you actually underwrite the premium. And when you do the wrong things, you don't price properly, you try to offer more than the premium can carry, you are actually destroying value. So this is the time for insurers to come together to set standards for plans that will be available on the platform and even across the country, and have ways for pricing ethically in a transparent manner, and have reviews that is backed by tariffs agreed with providers that actually represent the cost of healthcare, cost of consumables and drugs, and have that as input for the premiums that will now be the output at the end of the day. If this is done, providers will be happy. Claims will be settled properly. There have no changing of providers, and HMOs will also be profitable. Secondly, collaboration between regulators, the practitioners themselves, and LPHP, with standing as a bridge to make this happen. The words of the DG of NHIA is said that this is an innovative platform, and I believe so. I believe that can all come together to actually make this work. To answer a question about the pricing, the problem with the pricing with informal sector plans, from what I've seen, is an issue around the design of payments, not really about the premiums. Let me use Lashma plans, for example. If I'm correct, Mr. Oshika, the Lashma plan is 18,000 naira at the moment. 18,000 naira at the moment. Is that correct? 15,000. So if you take that and you divide it by 365 days, premium for that plan is actually less than 50 naira a day. So an average person in the formal sector, a petty trader, a wheelbarrow pusher, can afford 50 naira a day. But the challenge is that we want to collect 15,000 from them. It's not going to work because they don't make money that way. So I think the bankers are here. I believe that technology can solve this problem. We can have an automated debit system that can deduct about 50 naira per day from an individual to pay for that plan. But remember, bottle of Coca-Cola today is 250 naira. So I believe it's possible. Thank you.
All right. Thank you so much, Mr. Lusonya. Just like I said, I will just go around all the participants, maybe one question, 1 minute to be able to attend to the questions. Dr. Fula, I think I will come back to you because there's a lot resting on your table. Just like he has mentioned now, there's so many things you have to contend with. You have to contend with the issue of race to the bottom, which everybody complains about, underpricing, markets or rent-seeking behaviors of people that are purchasing health. And then at the other end of it also, you are faced with a financing problem. The banks are running away from you because they don't have what it takes in terms of confidence to say you want to pay back. If we are looking at the future, which is why we are here today, what will be your greatest hope or future outlook for Lagos State in terms of curbing efficiency that comes to the private providers, especially the private providers?
Is and will always be what we call the enabling environment. And I think we've all spoken to this. Njide has spoken to it. The enabling environment starts by really having at the table, really being able to help to shape even what that environment looks like side by side with government. And in doing so, I think we've spoken to each and every part of it. It is how do we create some more consolidation, both of the providers themselves, because right now the fragmentation is so significant that it is making it difficult for the provision of care to be sustainable. You know, everybody is their own infrastructure provider. Every hospital, every clinic has their own generator, has their own borehole, has their own X and Y and Z, even before they can provide care. So certainly consolidation and making sure that we are building platforms where providers themselves can share infrastructure, they can utilize infrastructure better to serve the population. It's the only way actually where price becomes more stable, where even what is being charged becomes more, more stable. But with that in mind, then certainly the work of what we're talking about today, really creating a stable market, a market where we can see sustainable pricing, sustainable premiums, that work. Because again, we were just talking about it. We have to think about what is the cost of care and what would the premiums that need to make sure we can deliver care. How does that work? We can, yes, say we don't want the race to the bottom. Nobody does. But to do so, we have to set a minimum standard of pricing that works, that is, gives what we call the right package of care. I don't want to put any numbers on the table, but I know that there's been a lot of work done, both in terms of what is the cost of care from a WHO and so on and so forth. But there's also been a lot of work done from an actuarial perspective, because what are the diseases we're covering? What is the real cost of care? So certainly being able to price correctly is critical. The other thing about being able to create the market is, again, a market where we have the right data. We have to be able to have data transparency. Transparency in terms of the providers themselves, because for investors to be able to put funding on the table, they need to know, what are the cash flows, what is the performance, and so on of providers. So a database, data bank of information. How do we benchmark what providers are doing? Their performance is key. And as I said earlier, outcomes. What are the outcomes of care that are being given from this system? So there's many different parts of it, but government, I think what we can say is that enabling environment, bringing all those streams together, bringing all of us together, and executing in a way where we're all working hand to hand. We saw it during COVID. I was very pleased to hear, of course, what Obina mentioned, the way in which we came together during COVID, the way in which the diagnostics and the diagnosis of COVID was handled by government, creating that enabling environment was simply, I have to say, awesome. I think we can do more like that. Thank you.
Thank you so much, Dr. Fulalawe. So just to round up, just the final word in 1 minute. You actually heard what Dr. Fola said. We need to bring a lot onto the table, and without data, a lot of these things will not be achievable. For the stand of HFL, how do you coordinate this coalition, especially for these private providers, to be able to speak with one word, to be able to speak showing data, to be able to speak showing evidence, because that is what a lot of them lack, to be able to move to the next level? How can you help us?
I think we're already doing the work. First of all, is to, align all of us with one voice, to begin to interact, creating an environment where there's dialogue amongst ourselves, first of all, aligning us first. I think that was the greatest piece of work we had to do. Understanding what the key strengths are and what we can bring to the table. And I think much of that is being done. I think we're pretty much getting to the point where we're very aligned. So taking that, we can then go to government as one voice, and we're already doing that. Now we're in part of the compact. Now we're basically every discussion that has to do with government, I think private sector is now at the table. So it's all around, either creating like an aggregation platform, or even showcasing examples that we can take to government. I think that is the stage we're in now. And of course, because this is a pro bono federation, we are also in the same vein looking for funding that can help us create some of these platforms, which we can then showcase in terms of what we can do. But I think we're already on the path. And I'm appealing to some of us to join the coalition, because we are stronger when our voices are all aligned. Thank you.
All right, thank you so much. Mr. Ushika, final words.
30 seconds. Well, thank you very much. This is as I said, it's the social health insurance person now, the private health insurance thing. But like for now, what they have already said, what is key for me for us to move forward is we need to have a common pool. That common pool, honestly, can only be provided if everybody, I mean, I always say, if everybody, imagine everybody in Lagos having a basic health plan. I mean, that's the bottom line. Of course, every other thing will be layered, and that was said extensively, in the LPHP and in what Lashma is doing. So we'll continue to strive to make sure that we do this. We're hoping to start full enforcement of both the executive order, from next year. So hopefully that would help us ramp up the figures. And the more number we have in terms of, people enrolled on health insurance, then keep saying it. Fola would go to the bank, a happy person. I'll be glad to talk to you. Thank you.
Okay. Well, thank you. Final word. It's impossible to have a working private health insurance scheme without the public partnering in the private. And I'll give a clear example. For those that provide healthcare, private healthcare providers and HMOs here, if you open your plan today, you'd say you offer, I'm just giving an example, you offer emergency health services or care, cover. And I'm covered with one very big premium plan. I'm somewhere in Lekki there and something happens. Who do I call? Where do I call? Now, you cannot build that infrastructure. The private sector, you can't build it. And if the public sector builds it, something has to sustain it. So there has to be that place where the private takes hand with the public, because you know as private that the things you're promising in your plan is a pipe dream. It's the infrastructure that drives it does not exist. So just this at the base, you know that it is impossible for you to even run a sustainable private healthcare business without having a very good handshake with the public. And I think that's what this platform is trying to achieve. Thank you.
Thank you very much, our panelists. Please, can we give them a resounding round of applause as they stand up for the photo ops? Can our camera people just take the picture of the panelists? I want to say thank you very much, Mr. Femi Akimbade, for moderating this panel session. Yes. Sorry. Can we have the photo up now? Can we just take a picture of our panelists? Thank you very much. I also want to thank Dr. Olumuyiwa Olusoya, independent health insurance expert, Njide Ndili Farm Access Foundation, Mrs. Folalaoye Iwosan Investment, Mr. Tosin Awoshika from Lashma, and the Executive Director of Business Banking for Sterling Bank, Mr. Obinna Pachuku. Can you give all of them a round of applause, ladies and gentlemen? The conversation has been about stakeholders' perspective, the future of healthcare financing in Lagos. Thank you very much for expounding the conversation as to how to make this viable and sustainable. I will give them a round of applause as they go back to their seats. Thank you very much for your time. Thank you very much, Mr. Awushika. Thank you. Distinguished guests, ladies and gentlemen, as we go to the interesting part of this lunch, I'd like to invite a few people for their goodwill messages, and I'll do that in quick succession. First, I'd like to welcome a distinguished banking leader, a visionary financial strategist, a stalwart in Nigeria's banking industry, and a highly respected leader in corporate governance, as well as a key partner in the financing of health and social development. Please make welcome for his goodwill message, the MD CEO of Sterling Bank PLC, Mr. Abubakar Suleiman. Can you give him a round of applause, ladies and gentlemen? The chairman of LIRS just walked in, Mr. Ayodele Zubair. Please, can you give him a round of applause, ladies and gentlemen? Thank you very much, sir.
Okay. Can you hear me? Ah, okay. Thank you. The Executive Governor of Lagos State, ably represented by my dear sister, I asked to stand on existing protocol. It's an honor to be here. Yeah. My comment will be just 5 minutes. I think the most important work of the day, it has taken us a few years to get here and a lot of work. What people in the room may not realize is the number of stakeholders that Lagos State had to bring together for today to happen. Even though you are the governor and you have the executive power, when it comes to getting things done, you need everybody to be on the same page. So let me start by thanking Lagos State for making this a reality. The role of Sterling Bank, whenever I find myself at event like this, I have to explain why Sterling Bank is here, because most people don't understand what the bank is doing here. Those who have paid attention, we committed as an institution that we're going to focus on 5 things, that will be known for doing 5 things and doing them well. And those 5 things is what we call the heart sectors. And the H in the heart sector stands for healthcare. So we deliberately agreed amongst ourselves that no matter how difficult it is to do healthcare, we will do healthcare. And it is that kind of commitment that brought us here today. And for those of you wondering what the rest of the heart stands for, E is for education, A is for agriculture, and I was at the Lagos State Agro Innovation just last week. R is for renewable energy, and T is for transport. So our commitment is that even though we are a bank, we must do the difficult things. It is easier to do the simple things, but we must do the difficult things. And this is not just comment. We have spent the last couple of years collaborating. We partnered with Lagos State on the Ilera Eco healthcare booths. For those of you who remember, that was a first time that the state government had decided to move healthcare closer to the people. It was a sweet spot between those who can access healthcare digitally through their mobile phone and those who still have to go to the large health centers. We also partnered with Lagos State. Obina referenced it, the Lagos Biobank digital platform. Again, Lagos led the country with that platform. Eventually, the rest of the country had to come onto that platform. And of course, we have an ongoing relationship with the Nigerian Optometric Association. But the reason why we are here today is that we have a challenge. And the challenge is the current healthcare system is expensive and will remain expensive unless something changes. And it's not just that people don't want to pay for healthcare, it's that most people actually don't have anything left to pay for healthcare if the current cost structure remains. And it also lacks transparency. And the problem with transparency is 2 ways. The providers are not in a position to reduce their costs because they actually can't see the full component of their cost. And the consumers, the patients, are not able to determine where they can get the best healthcare. And of course, there's fragmentation, and there is very limited use of technology. So despite the gift of technology, healthcare has not yet been able to benefit fully. And so today, we join Lagos State in making a clear statement. It's a statement of transformation. This is not copied from anywhere else that I know of. This is actually customized to work for Lagos State. It's a statement of partnership. I spoke extensively about all the different stakeholders that the state has brought together, and we are one of them. And it's a statement of intent, because once this starts, the marketplace, the unified marketplace that Lagos State has created will ensure that Africa can finally afford healthcare. And not just can it afford healthcare, African financial institutions will be able to finance the infrastructure required for healthcare to prosper. And so we as partner We are here first and foremost as a providing payment infrastructure. That is the easiest part of it, is what we do. We have also contributed extensively to the digital platform that will enable this to be seamless. We have experience from the work we did during COVID, and we brought some of that experience to bear. We will make sure that the onboarding is seamless, and most importantly, there will be real-time monitoring so that there's transparency as promised by the state. Together, we want to be able to achieve seamless access to healthcare plans for everyone who live in this state. We want to be able to create efficient HMO operations so that the providers themselves actually run better businesses because of the infrastructure we provided. We want to bring transparency so that when people use the system, they know they're getting a fair deal. And most importantly, we need expanded health coverage. This country needs expanded health coverage, and this is the way to go. Our commitment is that this platform will be stable, it will be secure, it will be user-friendly. And we will ensure that there is long-term sustainability because we've been doing this for a while. We will make sure that because of the platform, because of the data that is available, because of the access to information, capital will finally be available to those who work so hard to provide healthcare for us. This is a commitment. This is not just a paper statement. We will make financing available at affordable rates for people who need to provide healthcare for us. And all of this will be accomplished through collaborative expansion and through outreach. So once again, I want to thank the Lagos State government. I know we call ourselves the state of excellence, but I think we are increasingly becoming the state of innovation. Almost everything new comes from Lagos. Thank you very much. Thank you.
Give the MDC of Sterling Bank, Mr. Abubakar, another round of applause. Thank you very much. He's been a key partner in driving inclusive health financing for Lagos State. Another round of applause for him, ladies and gentlemen. While he was giving his goodwill message, the special advisor to the governor on taxation and revenue, Mr. Abdul Kabir Ogungo, walked in. Please, can you give him a round of applause, ladies and gentlemen? Thank you so much for being here today. And next up is someone who is a dynamic corporate leader, a seasoned executive in infrastructure and telecommunications, a strategic visionary in corporate services, a key partner in leveraging technology for social impact, a respected leader in bridging infrastructure and community development. Distinguished guests, ladies and gentlemen, Mr. Governor, please make welcome Senior Vice President and Chief Corporate Services Officer, IHS Towers, Mr. Dapo Otunla. Can you give him a round of applause, ladies and gentlemen?
Thank you very much. Good afternoon, distinguished ladies and gentlemen. All right. His Excellency, the Governor of Lagos State, ably represented by the Secretary to the Government of Lagos State, Honorable Commissioner for Health, Lagos State, all other dignitaries present. Good afternoon. I am delighted to join and deliver this goodwill message at the launch of the Lagos Private Health Partnership. And I bring you warm greetings and best wishes from my CEO, Mohammed Darwish, my colleagues and the management of IHS Nigeria. We are all proud to partner with you on this laudable initiative. I would like to begin with an introduction of IHS Nigeria, the organization that I represent. IHS is a subsidiary of IHS Towers, one of the largest independent owners, operators, and developers of shared telecommunications infrastructure globally by tower count. In Nigeria, we operate over 16,000 towers and have deployed over 15,000 kilometers of fiber across the country. We are now present in 7 markets across the world, in 2 continents, and we listed on the New York Stock Exchange in 2021. I have gone through the above for a reason. IHS was founded here in Lagos, Nigeria in 2001. Indeed, right here on Victoria Island. We are proof that sustainable enterprises can emerge from Nigeria, and Lagos has been the birthplace of many successful initiatives such as that we're celebrating today. Our humble beginnings here in Lagos means we're very happy to support initiatives that contribute to the development of the state and improvement of the well-being of her citizens. Indeed, when I got the letter requesting that we support this initiative, I think it took me all of 2 seconds to decide that we will support and we will be actively present and participating. I congratulate His Excellency Governor Babajide Sanwo-Olu, the Honorable Commissioner for Health, Professor Akin Abayomi, and the government of Lagos State for the state's ongoing health financing reforms and ongoing efforts to build a fair, efficient, and sustainable healthcare ecosystem for all residents of the state. The unified framework that LPHP presents is sure to strengthen the role of the private sector while ensuring that access, quality, innovation, and the creation of a health insurance scheme continue to prevail and succeed in Lagos. The initiative is ongoing here in Lagos State, and there will be many beneficiaries across the states for certain. We're happy to support the Lagos Private Health Partnership and look forward to how this will positively impact the lives of citizens across the state. Thank you very much.
Thank you very much, Mr. Dapo Otunla. Please, can you give him a resounding round of applause, ladies and gentlemen? Thank you very much. And our final goodwill for this particular program is from a distinguished leader in health administration, an expert in public health governance, committed steward of health policy and financing, a dedicated champion for accessible healthcare in Lagos State. Mr. Governor, ladies and gentlemen, please join me in welcoming Dr. Adebayo Adedowe, Chairman, LASTMA, a distinguished leader in health administration. Can you make the applause resounding, ladies and gentlemen? Thank you so much, sir.
Your Excellency, Governor of Lagos State, Dr. Babajide Sanwo-Olu, ably represented here by the State Secretary, Secretary of State to the Government, Mrs. Abimbola Salu Ondenyi. You're welcome. Honorable Commissioner for Health, Lagos State, the Chairman, Healthcare Commission, body of permanent secretaries here present, development partners, private sector, all stakeholders, ladies and gentlemen, good afternoon. A lot has been said by presenters, stakeholders, partners, and the private sector. And one common thing that recurs is the readiness to participate and collaborate with this initiative. Lagos State is always one champion of new innovations and initiatives. So the Lagos Private Health Partnership is another great innovation, which is aimed at providing efficient, sustainable financing mechanism in the health sector. It offers technology, innovative solution to reform with respect to the many challenges that has plagued the private health insurance space in Lagos. Its implementation is expected to have impact on the very private health insurance scheme as administered in the state. As a member of the stakeholder in Lagos State, the Mr. Governor has set up a technical working group of which I'm an active part, and
I have followed the development and progress of this healthcare financing system. So I am glad to be here and support and collaborate development that will unfold as we implement the Lagos Private Health Plan Partnership. I wish that all people who have spoken will spread the word and the readiness to collaborate with what is coming and improve our healthcare facilities in terms of proper modern financing scheme. Thank you very much. You're welcome.
Thank you very much. Please, can we give it a round of applause to the chairman, Lakshma, Dr. Debayo Adedewe, once again. Thank you very much. Even as we continue with the program this afternoon, I would like to welcome to the podium once again. He's been here before, but I would like to welcome him this time in a more, perhaps more friendly tone. Up next is someone who knows Lagos healthcare inside out. In fact, if you ever get lost in a hospital, he's probably the right person to call because he's helped to design half of them. Ladies and gentlemen, please put your hands together as I come forward to speak to detailing the rationale design as well as the strategic imperative introducing the Lagos Private Health Partnership. The Honorable Commissioner for Health, Lagos State, Professor Akin Abayomi. Please, can you put your hands together for him, ladies and gentlemen? I was at an event recently and was called the doctor that captured COVID. What did you call it? Dr. COVID. Can you give him a round of applause, ladies and gentlemen?
So good afternoon again, everybody. When I was preparing to come here this morning, I normally choose a tie that is in line with the mood that I have or the battle that I'm going into. And so I knew today that I had to wear a red tie. So that wasn't difficult. So I picked a red tie. From my red ties, I looked for one of them. And I thought, let me wear the red tie that signifies the body of the profession that I belong to. And so I chose my red NMA tie. And this tie is very dear to me because I'm proud to belong to the fraternity of healthcare providers in Nigeria. I'm proud of the great work that they do, not just the doctors, but every healthcare professional. We're all in this together. I must confess, I have jackpad several times, but I've also jackpadded. And as you can see, I'm on ground at the moment. I believe that the healthcare fraternity is in a crisis. And therefore, government cannot just sit back and hope that it will resolve itself. That is the function of government. And so government, like it has done in Lagos for decades, will seize the bull by the horns and do what it needs to do. In that regard, I'd like to carry out the order of protocol. The governor of the Lagos State, Mr. Babajide Olusola Sanwo-Olu, who's represented this morning by our SSG, Barrister Abimbola Saliu, Bundein, who has just stepped out to take a call, members of the Executive Council that are here, Dr. Mrs. Kemi Ogunyemi, who is represented by her SSA, Mrs. Sarah Balogun, my good friend, the SA Tax, Mr. Abdul Kabir Ogumbo. Thank you very much for coming to this event. The chairman of LIRS, Mr. Ayodele Suber. Thank you. Thank you very much. Our chairman that are here, the most relevant chairman to this occasion, Chairman of LASHMA, Dr. Bayo Adedewe. Thank you very much, and I really appreciate your words of encouragement. Chairman of the Health Service Commission, which is responsible for human resources in the public sector, Dr. Mrs. Atinoke Onaiga. Thank you very much for gracing this occasion. And all the other members of your boards that are here, the commissioners of the Health Service Commission, a large number of members of the body of the permanent secretaries that are present. Thank you very much for taking time off your very heavy workload to come to this auspicious occasion where we're trying to chart a new path in healthcare delivery in Lagos. There are many directors that are here, but many of us are already in Calabar, where all the senior members of state executives in the ministries of health are gathering for our annual National Convention on Health, Council on Health. I will be going there tomorrow. For the directors that have stayed back for this occasion, thank you very much for doing so. Top functionaries and heads of ministerial agencies, captain of the industries that are here, the MD, CEO of Sterling Bank PLC, my good friend and fellow comrade in arms, Mr. Abubakar Suleiman. You've always stood by our side. Lagos State Government is grateful to you. You are there and you are always there when we need you. And we are much appreciated. And thank you for your kind words. Senior Vice President of the and Chief Corporate Service Officer of IHS Towers, Mr. Dakwo Otunla. Thank you again for your warm words and for supporting this meeting. We're really grateful that you believe and you trust in Lagos State Government. The Director General of the National Electrical Contractors Association, NECA, I can't be right, electrical. Who wrote my protocol? Employers. Take that again. National Employers Consultative Association. I'm so sorry. My good friend, Mr. Wale Smart, and thank you to Mr. Thompson Akpabio for representing him. I did see him at Abuja at the retreat we had only a few days ago at the NHIA, where we went and came together to align what Lagos is doing with federal government. And it was a real pleasure to exchange ideas with him as usual. And the representative of the MD CEO Aliko Dangote Foundation, sorry, the MD and CEO of Aliko Dangote Foundation, Mrs. Zoera Yusufu. Once again, you're always by our side. Thank you so much for coming. You were there during COVID. You're there. Included panel. Thank you very much. There was a lot of food for thought that came out in that panel discussion, and we're grateful for that. The health development partners and stakeholders, public and private health practitioners, members of the health fraternity, distinguished invited guests, gentlemen of the press, thank you for coming to what we believe is a turning point in Lagos State's health sector. If I may grade this event in terms of importance in my position as Commissioner for Health in my second term, I would easily give this event the highest priority. If there's anything that I would like to carry as a legacy, is the fact that I've heeded to the cries of the sector and that we've responded in a way that government should respond. So my talk today is health financing reforms, something that we've embarked upon now for several years. And today we're coming to speak about a particular aspect of the health sector that requires significant attention. So let me start by stating what the problem is in terms of what we've been talking about all morning. The capacity to pay for health has started to bear a heavy burden on citizens, not just in Nigeria, across the continent and globally. I believe that COVID had a significant part to play in this. Several governments have gone through economic hardship. And locally, globally, and locally, we're finding health become more and more expensive. Over the last 3 years, the amount of money required to pay for health has tripled. The funding required to resource healthcare professionals is increasing. And the amount of money required to purchase essential medicines and consumables has also escalated. At this time last year, in October 2024, we came across this article in the newspaper, in the Punch to be precise, where the chairman of the Guild of Medical Directors, that is private hospitals in Nigeria, Dr. Raymond Kuti, made a staggering statement. And he said that 50% of private hospitals in Nigeria have shut down in the last 3 months. And he ascribed this phenomenon to a number of situations. He said, bearing in mind that private sector cater for 70% of the population, we need the government to recognize the challenges we face and provide the necessary policy environment to ensure that private hospitals can continue to operate and serve the community alongside government. Some of the biggest issues he ascribed this to were a workforce crisis. The JAPA phenomenon, brain drain, has led to many healthcare professionals leaving the country for better opportunities, compounding the human resources for health deficit. He also described declining patient patronage. Economic strain has also led to a reduced number of patients patronizing these facilities, pushing many facilities to the brink of collapse. Insurance uptake is low, and patients are no longer able to easily pay out of pocket. Over the last couple of years, government has been doing some systems analysis, and a decade of health insurance that is meant to catalyze healthcare financing in Lagos has not been effective, as we heard from the panel, for the following reasons. We've not been able to enforce health insurance in our citizenry, the uptake. There has been an unhealthy rivalry and race to the bottom pricing of private healthcare plans by the HMOs to gain market share. There is significant amount of stigma associated with people who carry health insurances. This is very unlike when you go abroad, where hospitals will actually frown at you if you try and pay with cash. It is a normal expectation that you put an insurance card or two on the table. But in our environment, insured patients generally are denied access to quality care, leading to them reaching out into their pockets to pay for quality service. And there's some restriction to certain hospitals by HMOs and the inability of providers to deliver quality healthcare to insured patients due to poor funding and reimbursements. So what is the evidence of what we're talking about? Well, the evidence is clear. Nigerians are spending more and more on medical tourism, leaving the country to go to Dubai, to Turkey, to South Africa, to Europe, to India for healthcare, spending precious Nigerian foreign exchange. Our workforce is declining. We're not able to produce enough doctors to match the brain drain. We have a shortage of medical professionals and a shortage of medical beds. So what is the impact? The impact has resulted in effects of all these is a healthcare ecosystem filled with unhappy people across the entire health delivery value chain. Let us try and prescribe some solutions. As government, the most effective tool that governments have is policy, strategy, and the ability to inform and enforce. Given the situation, the Lagos State government has no option but to step in as an honest broker, implement a health financing reform policy and strategy to revive the health sector in the state across the intertwined public and private segments. Lagos, over the past 4 years, especially since after COVID, has mapped out an elaborate health finance reform strategy. We've worked hard, and my colleague from Cabinet is here. We work hard at trying to ascribe more budgetary allocation to health year in, year out. And I must say that Mr. Governor has graciously acceded to our cries, and our budgetary allocation is increasing. When we put all factors together, I suspect that the health sector is, if not close to 15% of budget, has exceeded it, which is in line with the Abuja Declaration. And I believe Lagos is the first. We need to make healthcare more efficient and streamlined. And to do that, Lagos has introduced the Smart Health Information Platform, which is the complete digitalization of the health space, starting with the public sector. And we've awarded this concession out in the last 6 months. And gradually, we are digitalizing all our public health facilities, both with infrastructure and with software, and with the interconnectivity and the training that is required to transform our health sector to a digital platform. If we do that, we're going to make operations less expensive and we'll be able to cut waste. In terms of quality improvement, Our HEFAMA agency, the agency responsible for ensuring that our health facilities are up to standard, is working very hard franchising its function to the private sector to make sure that we can reach the 2,500 registered healthcare facilities in Lagos on a regular basis. If we're trying to transform the financing health sector, we need to pay attention to quality, which brings me to our next point in our transformational agenda, which is insurance and the executive order to domesticate the National Health Insurance Authority Act of 2022 will lead to a health insurance increased uptake and expansion and improved quality through enforcement. This will exponentially increase the funding that is available to the health sector. The number one citizen of Lagos has made it clear to the health sector what he wants. He wants to see our health indices of maternal mortality, infant mortality, poor nutrition decrease exponentially. Lagos, Nigeria, and many countries in Africa have some of the worst health indices globally. But in Lagos, we feel that this is unacceptable. And so Mr. Governor has keyed into the health financing reform agenda by giving us the mandate that there needs to be rapid uptake of good quality insurance packages to suit all residents across public and private, utilizing principles of solidarity, cross-subsidy, and risk equalization to achieve a healthy population complete globally. In the words of a famous health economist, no nation is able to achieve universal healthcare coverage without compulsion and cross-subsidization. Both elements are equally important and essential. So what has Lagos State done? The moment the National Health Insurance Authority Act was promulgated in 2022 by the former president of Nigeria, Muhammadu Buhari, Lagos immediately saw the opportunity because inherent in that law was a clause that Lagos has been clamoring for decades. And that clause simply states that from the moment that law was released, health insurance now became mandatory in Lagos, and precisely social health insurance as a baseline. And so Mr. Governor was quick to respond and to domesticate this national law through an executive order. And that's the fastest way to domesticate laws. And inside this executive order, it is directing that all residents, employers, and workers shall procure social health insurance either through our agency, LASHMA, or through any NHIA accredited health insurance provider registered with the Lagos State government before private top-ups are permissible. So let us talk a little bit about the principles of social health insurance or health insurance. And Dr. Adeboje did a very fine job that earlier on. The power of health insurance lies simply in the powerful principle of solidarity. By pooling our resources, we share the financial risks of illness so that no one is left to face a catastrophic health crisis on their own. Haphazard and chaotic payments out of pocket should be channeled through a structured and pooled insurance contribution scheme. The principles that make health care accessible, affordable, and equitable are pooled funds, contributions from individuals and or employers are pooled to cover healthcare costs. Solidarity, healthy individuals contribute to support those who are sick or need care. Risk pooling, spreading risk amongst many to cover unexpected medical costs. And so cross-subsidy is the principle in which funds are redistributed from healthy to sick, from rich to poor, from young to old, and from private sector to government to ensure adequate cover for the vulnerable in our communities. Catastrophic health expenditure, we need to protect against extremely high medical costs that can financially devastate individuals or families. In this cartoon, I'd like to just demonstrate the principles of cross-subsidy and risk pooling. So in every community, just like in this hall we have here, I can honestly say, just as a medical professional, just by scanning you, I suspect most of you are rather in a good state of health. And so I would put you in this circle here. So you're all healthy and happy. At any point in time, you could become unwell. Now, we know that not everybody is healthy at the same time, and not everybody is unwell at the same time. And so those who are well should support those who are unwell. And that's the principle of cross-subsidy. Rather than you being dependent upon yourself, that when you are unexpectedly taken sick, that you have to fend for yourself because you may not be able to have, or you may not have the resources to actually manage your healthcare condition at the time something happens to you. And so if we put all of you together into a pool, and inside that pool, you will have most people remaining healthy, but some people getting sick. And so the larger that pool becomes, which is the principle of compulsion, whereby through government enforcement, first with encouragement and then with enforcement, people partake in health insurance, the pool starts to expand and the funding starts to have more impact supporting what government is trying to do. And so there is power in the number of people in the pool, because the more people there are in the pool, the more funding there is available to take care of the sick without it affecting anybody individually in any excessive manner. So let us do a little bit of mathematics. If 20 million of the 30 million Lagosians actually take out the most basic insurance contribution of 20,000 naira, let us just say, and insurances are more than that, but let's just use even the most possible cheapest contribution. 20,000 times 20 million is 400 billion naira injected into the health sector. And if we raise that premium to 100,000 a year, we're looking at 2 trillion naira. Now, last year, 2 trillion naira was the entire budget of Lagos State's government. Now, you can just imagine if the health sector had these resources at their disposal, what a paradise Lagos would be in terms of healthcare delivery. But this is actually what happens. This is the contrary, and this is the reality. Nigerians actually spend 33 trillion naira every year on health. Believe it. So there is money in health. 79% of that happens in the private sector. And a staggering 77% of that 33 trillion naira is spent out of pocket. And only 2% comes from any form of insurance. Now, if you went to America or to South Africa or to Europe, it's the reverse. And so, what must government try and do? We must try to discourage out-of-pocket expenditure and convert this haphazard spending into a more organized and regulated structure. And so that 25 trillion naira that is spent out of pocket needs to be harnessed into insurance. Because out of pocket, you're on your own. You get sick and you pay for yourself. But if you put a fraction of what you would spend out of pocket into an insurance, and there are millions of you doing the same thing, then we are all in it together. And we can look after each other without stressing our resources and our finances. At the same time, 3 trillion naira is spent on medical tourism side of Nigeria. And it's not because I'm from Lagos that I want to make this statement, but Lagos would like to be the capital of medical tourism in West Africa, if not sub-Saharan Africa. And we first and foremost would like to keep that 3 trillion naira in Lagos and attract reverse medical tourism from other countries in West Africa so that we can escalate that 3 trillion to 10 trillion or 20 trillion and positioning health as a major contributor to the GDP of Lagos State's government. I think Lagos can do that. And all we need is a structured policy framework that will help us to get there. Now, people say that Nigerians don't have an insurance culture. I totally disagree. There is a practice, and I come from a farming family, so I'm used to rural environments. And everybody in the rural community practices Esusu. You all know it. If you don't know it, then you're too ajebota to understand it. But what does it do? People in a community, they're usually from a village or a family, they contribute on a monthly basis. And then at some time, the contribution pot comes to you. And you can use it to either buy a house or to send your children to school or to make or start a business. And it has incredible benefits. Access to a lump sum, encourages savings and fiscal understanding, builds community and social connections. But whenever someone is in crisis, you can tap into it. And on my way here, I even asked my driver, I said, "Are you a contributor to Esusu?" And he said, "Of course." And everybody in his family is a contributor. And so we are an insurance conscious culture. We just need to put it into the right context. So there is need for risk equalization and elimination of predatory practices that has dogged the industry. So the risk equalization strategy is a key mechanism used in many countries to promote fairness and sustainability in health insurance markets. The first thing that needs to happen is a state-level risk equalization mechanism. A portion of all contributions collected by participating HMOs in the LPHP should be pooled into a risk equalization solidarity fund. Number two, premiums are standardized by the stakeholders based on economic realities and self-regulated with oversight from government. And hence, there is the birth of the Lagos Private Health Partnership. In this partnership, we're bringing both public and private sector together. From the executive order, and after the extensive engagements, the LPHP was conceived as a public-private collaboration with Lagos State government facilitating the process. It is a mechanism that is engendered to amalgamate the basic minimum package of social health insurance into a private plan, introducing cross-subsidy and standardized, actuarially determined premium plans based on economic realities. So it's a handshake between the public and the private sector. And so it gave birth to the Lagos Private Health Partnership Operational Guidelines, which is what we're talking about today. Hypothetically, we have envisaged examples of how the social health insurance is embedded in standardized private managed care plans that will be marketed in Lagos. And you can see from this cartoon that we have a range of premium plans. Each one of them has been actuarially determined by the stakeholders, which are the HMOs, the healthcare providers, Ministry of Health, LASHMA, and the NHIE, because each premium that is delivered in Nigeria must be accredited by the NHIE. And following our meeting in Abuja last week, it was determined that Lagos State government, LASHMA, and the NHIE will work with the important stakeholders in Lagos to establish actuarially determined premiums that have hard floors. In other words, you cannot offer a package of services for less than what that tier commands actuarially. And so when we run across from blue to bronze, silver, gold, and bespoke, you can see at the bottom that we've made sure that there is the basic minimum package of health services in green, which is the social health insurance component in each and every of those plans. So you are now, if you purchase one of these premiums, you are now compliant with the NHIA law and with the LASHMA law and with the executive order, because they state that you must first have social insurance before you have top-up. And in this picture, you can see that each and every one there, from the blue, which is the basic, the next one is the bronze. It has the basic plus 5 additional services. The next one is the basic plus 11. The next one is gold plus 25. Now, these are arbitrary numbers, but this is the principle. And we've done some actuarial science around this already as government, but we are expecting that this process will happen in the community of healthcare providers and insurance marketers, so that this is not something that we are imposing on you, but that you are defining yourself and just coming to the Lagos State government and the LASHMA agency to double check it before we present it to NHIA for accreditation. And so the principles of solidarity contribution, LPHP, is an instrument to deliver health equity. So inside there is cross-subsidy, risk equalization, a solidarity contribution currently set at 13% of every private premium will be dedicated to subsidizing care for vulnerable and indigent populations, public awareness, and financing emergency medical response. Under these arrangements, each HMO will remit the solidarity portion of their premium collected to a state-managed solidarity and equity fund domiciled within the state treasury. This solidarity mechanism transforms risk equalization and cross-subsidization into a structured fiscal instrument. It ensures that equity and inclusivity are financially sustainable. It also provides a transparent and accountable system for channeling private sector contributions into public good outcomes. We have many stakeholders, very important stakeholders, and this slide just shows you how complex the ecosystem is, with the NHIA and LASHMA, who are the main regulators, private HMOs, and on the right, the healthcare providers and the health facility regulators, the employers associations, the Lagos State Ministry of Health, everybody coming together to respond to the cry of the sector and to innovate collectively. Nobody knows the answer. We just know that the sector needs help, and we need to put our heads together collectively. Everybody combining their thought process, their experience to achieve universal healthcare coverage. And as you've heard, and it was clearly depicted during the panel, that the health sector currently functions in a very fragmented structure. And all government is trying to do here is to harness everybody, and government has the power to bring everybody to the table. And that is exactly what we're doing and have been doing for the past 2 or 3 years. And today is the climax of hours and hours of stakeholder engagement that has resulted in a pathway that we feel is going to create a structure that is organized, that is functional, and that takes everybody's interests into consideration. The LPHP therefore emerges not as an isolated innovation, but as a accumulation of evolving state reforms, an instrument to harmonize financial flows, stabilize the healthcare market, and embed equity into the very fabric of healthcare delivery. And so how is this going to pan out? For the purpose of domesticating the NHIA Act of 2022, Lagos State has classified its workforce into 2 major categories. The workforce entities that have less than 100 employees, which make up almost 97% of the workforce through nano, small, and medium enterprises. And there was a SMIDAN conference this morning. I wish I had the time to attend, because I find that this understanding is key to the solution. That majority of the workforce of Lagos State are actually in nano, small, and medium enterprises. Contrary to what people think, that the large corporate entities carry the majority of the workforce. And so on the right is entities with more than 100 employees, who we believe are the large corporate entities, and they only make up 3%. But the LPHP is targeted at these corporate entities for a start. And this cartoon tries to explain how Lagos State government is going to adjudicate the LPHP. On the left is entities with less than 100 employees. They have a choice to go straight to LASHMA and purchase the social health insurance. They have a choice to buy the social health insurance and then buy a second insurance from the private sector if they choose to. That way they are in compliance with the law. So either way, if you buy straight from Lashma, you are compliant. If you buy Lashma and then buy a top-up private, you're compliant. Or you can go straight and buy a private sector insurance that's within the LPHP. Now, the workforce the health sector is divided vertically by this vertical blue line, which divides the public sector from the private sector. So the private sector is on your right and the public sector is on your left. The public sector enjoys significant amount of subsidy from government. And so we have major, large general hospitals and a large number of PHCs, over 300, about 30 general hospitals and one tertiary academic. And they enjoy subsidies from government. And they're there to provide the standard of care, but to also make sure that citizens of Lagos who are not insured or who have any kind of medical condition are able to access care without breaking the bank. On the right is the private sector. Now, they're not subsidized because they perform under economic realities. They build their hospitals, they buy the land, they employ all their staff, they pay all their bills, they buy all their consumables. And so it's a slightly different kettle of fish from public sector. And the companies that have more than 100 employees, government is saying you belong to the large corporate entities, and therefore we're going to usher you into the LPHP consortium, where you're going to have access to these standardized, actuarially determined premiums that have the social health insurance embedded in them. So if you access your premiums from any of these HMOs, you are automatically compliant and you'll be issued with a certificate of compliance, which means that you satisfy the law. So that's the first aspect of the LPHP, standardization of premiums and ensuring that we have oversight over them, that there can't be the race to the bottom. In other words, competing amongst each other to offer services that cannot be carried by an actuarially determined premium is going to end. The second part of the LPHP is this cross-subsidy, where 13% of the premium paid by persons purchasing the LPHP goes into the principle of cross-subsidy and risk equalization, whereby that money is used to pay or contribute to the equity fund. And the equity fund is that fund that government pays into every year to provide health insurance and care for people that cannot afford even the most basic and simple premium price. It will go into demand generation, which is what we're going to embark upon in the next few months, promoting the concept of health insurance as mandatory in Lagos State in compliance with the federal law, the state laws, and the executive order. To cater for emergencies. Every day we have an emergency in Lagos of different proportions. And when we carry the injured to the nearest hospitals, everybody is wondering who is going to pay for these emergencies. Whether it's a private or a public hospital, somebody has to pay the bill. And so some of this money will go to stabilizing people who are not in a position to even perhaps identify themselves. Because when you're taken from an injury site, a collapsed building, a road traffic accident, in an explosion, nobody has time to ask for your insurance or who you are. We're just there to try and save your life. And then, very importantly, to contribute to the supply side upgrade of the public subsidized facilities. So this subsidy contribution is supporting government to maintain the public sector and to upgrade the quality and the standard in the public sector so that eventually we can deter our doctors and professionals from leaving the country. We can build a health ecosystem that we can be proud of, and that collectively we've been able to say we've participated in achieving universal healthcare coverage in Lagos. Eventually, and we're embarking upon this LPHP as a 6-month pilot, we hope that after the 6 months, we would have ironed out any kinks and we would have perfected the system. And then we'll open it up again for interested HMOs to join. And hopefully, more of the healthcare providers will enter into the consortium, and everybody on the right-hand side in the private sector will be a member of the LPHP consortium. And even then, we envisage in the future that some government hospitals may wish to partake in the LPHP and raise their standards to be able to provide private healthcare to citizens of Lagos at international best practice standard. And so this slide just demonstrates again what I've just described, that the cross subsidy will go towards financing equity for those that cannot afford it. And 66% of Lagosians are classified as vulnerable. And therefore, the onus as citizens of this state is that we are each other's keepers and each other's caretakers. The second disc there is to create awareness around social health insurance and the mandatory nature of insurance. Third disc is to support government in improving supply side in the public sector. Fourth disc is to support the digital platform and support the delivery office to make sure that we can manage on a day-to-day basis the adjudication of the LPHP. And the fifth disc is the emergency response that is so badly needed in Lagos, whereby you're brought into a facility and for the first 48 hours, funds from this solidarity fund can be diverted to look after you until we know who you are and until your family can come and help with your medical situation. So has this kind of reform worked in other environments around the world? Recently, I led a team to a country called Malaysia, which is in Southeast Asia. And the reason we chose to go to Malaysia is because Malaysia and Nigeria were very similar 30 or 40 years ago. We got our independence around the same time from the same colonizers. Lagos and Malaysia have had a similar economic trajectory. They have a similar population of 30 million people. And so we went to see what was happening in Malaysia and to try and take some lessons from Malaysia and try and see how we can apply them in Lagos. When we got there, we were a bit stunned. Lagos has 300 PHCs to service 30 million people. Malaysia has 3,000 PHCs to service the same population. Lagos State has a total insurance cover of about 6%. Malaysia and Nigeria and Lagos have a similar two-tier healthcare system with both public and private. But look at the coverage of insurance. 55% of Malaysians' population are covered by a harmonized public-private health insurance sector, as well as subsidized public healthcare services with very low out-of-pocket expenditure by its citizens. Now, on the right, you can see the health indices of Lagos. Our maternal mortality rate is 555 maternal deaths for every 100,000 women giving birth. Our neonatal mortality is 35 for 1,000, and our malnutrition is at 30%. Our tax to GDP ratio is in Nigeria about 7% extrapolated to Lagos. In Malaysia, look at their maternal mortality rate, 25 compared to our 555. 4 for infant or neonatal mortality compared to 35 for us. The tax to GDP ratio is 15% and their malnutrition is 2%. What stands out between these two geopolitical zones? From this slide, it's simply the magnitude of insurance cover and the amount of money that is put into the system by small contributions of almost half of the population of Malaysia. So about 17 million Malaysians are contributing to a national health insurance scheme, supporting government to provide healthcare services, especially where the tax to GDP ratio is low, like we have here in Nigeria and in Lagos. And that is why the esteemed gentlemen are here, my colleagues from LIRS and my cabinet colleague, constantly racking our heads on how to improve the tax to GDP ratio, because you can't get water out of a stone. To access services, you should pay your taxes. And it is from the taxes that you remit to government that the government can provide services. The critical role of government in public education and enforcement, our pledge to the health sector. Inside the executive order are some very important tenets. All ministries, departments, and agencies are hereby directed to ensure that all residents seeking to access their services must have subscribed to Lagos State Health Insurance Plan or scheme through LASHMA or the Lagos State NHIA private health insurance provider. B, all MDAs are hereby directed to request proof of compliance to the executive order. In other words, that you have either a social health insurance as a solitary insurance plan, or you have an LPHP private plan that has social health insurance embedded within it. C, all residents of Lagos State who do not possess a valid state social health insurance plan will be required to register or renew their expired plans before they can access any public or private healthcare facilities. And I'm very proud of LASHMA. They've not joked with the executive order since it was released in July of 2024. They've been actively campaigning and promoting the concept and public awareness of the mandatory nature of social health insurance. And that is the request of Mr. Governor, that we should give the public of Lagos at least a 6 to 9 month lead using a massive campaign to the public before we start to introduce the elements of enforcement. And in this picture, you can see the chairman and the permanent secretary and many other permanent secretaries and the director general of NHIA, Dr. Kelechi Ohere, coming together to witness the public awareness campaign among civil servants and permanent secretaries in the civil service. Our pledge to Lagosians, our pledge to HMOs, our pledge to the healthcare providers is that government takes its responsibility of enforcement and public health awareness seriously. And in this graph, you can see that in red, from 2016 to 2025, which is where we are now, we've had a very modest increase in uptake of health insurance. So much after all the work we've been doing, only 3 million Lagosians have any form of health insurance. And that is at its best number. But the moment we start our health insurance campaign, which has started, and we're going to step it up now into the Christmas, and from January, the chairman has given me his assurance that all hands will be on deck, and we're going to join him, and all agencies are going to join. We're going to be promoting health insurance like you've never seen before. But on top of that, a law without enforcement, they say, is just a piece of paper. It's just like you having a car and trying to drive the car without a license or without an insurance. The law will catch up with you. And the moment a policeman stops you, you will understand what mandatory nature of licensing and insurance means. And so we promise the sector that in the next 2 to 3 to 4 years, that the number of people that will, by law and through enforcement and through awareness, that number will exponentially rise until we can achieve what Malaysia has done and achieve what many other countries are doing around the world to reform health financing through pooled resources and health insurance. And there are the 4 instruments of compulsion, which I've just described, and the instruments of discipline and transparency. So the stakeholders, as we're all gathered here today, to listen to the voice of the governor, to listen to the voice of the Ministry of Health and all other agencies, that we're here because we mean business. And we need to wrap our heads together and to be honest participants in this process so that we can aspire to have a Lagos state that is able to achieve universal healthcare coverage. Lagos state that you can access any type of medical intervention that you need without having to leave the country to access such services. All that the government is doing is playing the honest broker, the coordinator or the conductor of a symphony of players in the stakeholder space of the health ecosystem to ensure that we reach harmony and alignment and understanding, and that nobody should try to undermine one segment over and above the other. And so universal HMO freedom within a structured regulatory framework. First of all, it's crucial that all HMOs accredited by the NHIA retain the freedom to operate across Lagos State, provided they adhere to the tenets of the executive order and the operational guidelines. For enterprises with less than 100 employees, as I've outlined, may access from Ilera Eco or from the LPHP as they choose. For enterprises with more than 100, and we believe this represents by a wide margin the large corporate sector of Lagos. Initially, we had put that number at 20, and enterprises with 20 or more employees were considered to be large corporate. We were advised to give Lagosians some time to acclimatize to this, and in the interest of affordability, we have increased it not to 50, but to 100 to make sure that we're dealing with the large corporate sector that are able to absorb this new transformation. All premiums will be actuarially determined through a Ministry of Health, LASHMA, NHIA joint collaboration with healthcare providers and accredited by the NHIA. So the legal alignment exists. The market discipline is going to be put in place. LPHP establishes standardized base premiums. The cross-subsidy will be activated, and the systemic coherence will roll out. In conclusion, ladies and gentlemen, we cannot afford to have two sets of healthcare delivery. Healthcare delivery for the poor and healthcare delivery for the rich. This is Lagos. Everybody deserves the standard of care. And so through health insurance, through our health financing reforms, through cross-subsidy, through risk equalization and solidarity, we plan to put one standard of care on the table, no matter who you are, no matter what facility you choose to access your care. The Lagos Private Health Partnership stands as one of the most relevant policy innovations in the evolution of health financing in Lagos State, a system designed not merely to reform how healthcare is funded, but to redefine how it is governed, delivered, and sustained. We expect that in the next 5 years, there will be an increase of up to 70% insurance coverage in Lagos State and a 40% reduction in catastrophic out-of-pocket health expenditure by our citizens. We look forward to a Lagos State where everybody, as depicted by this cartoon, whether you're rich, you're poor, whether you're employed or unemployed, whether you're old or young, whether you're sick or healthy, we are all each other's caretakers. And therefore, it is important that we are in a position to protect each other from catastrophic health expenditure, from biological shocks, from emergencies that have the potential to wreak havoc, and to be in a position to achieve universal healthcare coverage in Lagos. My final slide takes us on a roundtable analysis. From number one, from being able to put actuarially determined plans on the table for citizens and to be able to monitor them, for us to introduce cross-subsidization and risk equalization through Solidarity Fund, for us to reduce brain drain, because the moment our doctors and our healthcare professionals feel that they are being rewarded in a manner that is comparable to their counterparts in other countries, the phenomenon of brain drain will automatically cease. In fact, we may be on the verge of seeing a reversal of brain drain and seeing the beginning of brain gain, which incidentally, I must say, I believe has already started. I have on my desk several letters and applications and proposals from Nigerian healthcare professionals all over the world, congratulating Lagos State government for creating a milieu that seems attractive for our healthcare professionals to start coming back home and to contribute to the GDP of this great state and this great country. We believe that we'll be able to protect our residents from financial ruin, and we'll be able to make Lagos State the center of inbound medical tourism. So, what are the next steps? We've released an expression of interest, and as of today, 15 HMOs have indicated their interest in voluntarily participating in this pilot phase. Remember, thank you. It is a 6-month pilot. Nothing is cast in stone. And I take my hat off to these HMOs who are bold enough and adventurous enough to partner with government to see how we can change the narrative moving forward. We're going to release a request to those 15 to submit their proposals. There will be an onboarding of the 15 HMOs and prepare them for what is ahead in the next 6 months, which is the pilot phase. And in that 6 months, and you can't believe how involved Mr. Governor is in this process. And I really feel sad that he had to be called away to Abuja this morning at very short notice, sent a message to say that cannot unfortunately be here. But there is no part of this journey that he has not been involved in. He has read every report. We've had numerous meetings because this means so much to him. And he is going to be very involved in the analysis of the 6-month pilot phase. The lessons learned from this 6 months will inform the modifications, which will then result in opening up the consortium to other interested HMOs and a formal hard launch of the LPHP. On that note, I wish to thank you for your attention. And thank you for participating in this innovation. Thank you.
Please can we give the Honorable Commissioner for Health, Professor Akin Abayomi, another round of applause. Ladies and gentlemen. So how do you know that the Commissioner for Health is a professor? I have never seen a man so intentional in elucidating or articulating his thought process like he has done as to what LPHP is all about. Once again, can you give the HC Health a round of applause, ladies and gentlemen? Now, I guess when the HP was speaking, it was speaking to those who know and who are critical stakeholders to understanding what the LPHP is all about. And I think significantly, he has passed across the message and he's doing what he's supposed to do in explaining what this initiative is all about. Please, can we give him another round of applause, ladies and gentlemen? While he was speaking, the Honorable Commissioner for Finance walked in, Mr. Abayomi Oluyomi. Please, can you give him a round of applause, ladies and gentlemen? The HC Finance, oh, it's somewhere there by the door. Thank you for being here today. Distinguished guests, ladies and gentlemen, we're getting to the crescendo of this program. And at this point, without much ado, it is my honor, singular honor and pleasure to welcome to this podium the Governor of Lagos State, who is ably represented here today by a distinguished legal luminary, a seasoned advocate and dedicated public servant, an astute manager of public affairs and human resources, a committed champion of excellence and integrity. Please join me in welcoming Barrister Abimbola Salmodei, a distinguished esteemed secretary to the state government of Lagos State. Please, can you give her a round of applause, ladies and gentlemen?
Okay, sir. Thank you very much. Please be seated. Thank you. Good afternoon, ladies and gentlemen. My name is Bimbola Saluhundain, and I am the Secretary to the Government of Lagos State. Mr. Governor Babajide Olushola Sanwo-Olu actually wanted to be here. As you heard from the Commissioner, other duties are equally important, took him away. The Deputy Governor also volunteered, and another thing happened, he too had to be. So I was asked to be here because of the importance of this program through the administration of Governor Babajide Olushola Sanwo-Olu. So I have learned quite a lot today, and I know everybody here had been richly blessed in terms of knowledge on what we're here to do. So I would just want to go straight to Mr. Governor's speech. First, I'd like to acknowledge my colleagues who are here, members of the State Executive Council, particularly the Honorable Commissioner for Health, Professor Akin Abayomi. He actually delivered a professorial speech here. So that's how you know professors. Um, the special advisor on taxation, he's been here since, and I think the finance commissioner, but I think he has left, but he was here. Members of the body of permanent secretaries here present, particularly the permanent secretary of the Ministry of Health. The chairman, oh, where is he? He too was here, Lagos State, I saw her. I saw her. The chairman, Lagos State Health Management. I think at this juncture, let me just stand on existing protocol because I can't see most of the people that I intend to acknowledge. So you're all very, very distinguished. I will go straight to Mr. Governor's speech for the day, his keynote address. Thank you. Distinguished ladies and gentlemen, esteemed members of our healthcare family, captains of industry, respected partners from across Nigeria, friends of Lagos, and all those who join us today with a shared belief in healthy living and progress. This gathering carries a special meaning for our state. We have come together to celebrate a major step forward in our journey towards building a healthcare system that reflects the strength, courage, and possibilities of our people. Today, we launch a significant segment of our health sector financing, reform from agenda, the Lagos Private Health Partnership, LPHP, and we do so with pride, purpose, and gratitude. Lagos is a city that rises every day with determination. Our markets, our corporate corridors, our communities, and our streets come alive before sunrise, moving through the day with confidence and echo with the rhythm of millions, building a future for themselves and generations to come. With a population exceeding 25 million residents, Lagos stands as a beacon of enterprise, resilience, and prosperity on the African continent. The three tiers of government share a responsibility to create systems that support the well-being of our people. Through the Lagos State Ministry of Health, our administration has embarked on comprehensive reforms to strengthen healthcare financing for this generation and the next. In this context, the National Health Insurance Authority Act NHIA of 2022 ushered in a new era for healthcare financing in Nigeria. Lagos embraced this opportunity with seriousness and dedication by signing an executive order in July 2024 to domesticate the act, compelling all Lagosians to obtain health insurance as a first-line social safety net against catastrophic healthcare expenditure. The executive order outlines enforcement mechanisms to ensure sustained and progressive uptake until we achieve universal coverage. This development catalyzed statewide engagement and led to the creation of the technical working group comprised of all relevant healthcare delivery stakeholders. Their work culminated in the operational guidelines for the implementation of the executive order. These operational guidelines gave birth to the first pillar within the broader health financing reform landscape, the Lagos Private Health Partnership. The Lagos Private Health Partnership structures private sector participation in the social health insurance space clarifying how private health insurance and providers can be seamlessly integrated into a sustainable and progressive unified health financing strategy in line with the NHIA Act. It strengthens collaboration, aligns private sector capabilities with state possibilities, and ensures that residents receive services with confidence, clarity, and fairness, ultimately stabilizing the health sector economy and increasing its contribution to the GDP through a stronger human asset. Through a deep, proactive, and productive partnership with the NHIA, we have harmonized approaches by combining resources to strengthen private sector participation. Together, we have aligned expectations, built shared standards, and created a unified structure that enhances oversight and expands the reach of health financing. This reinforces quality, accountability, and equity in service delivery to the people of Lagos. Using reliable data from the Small and Medium Enterprises Development Agency of Nigeria, SMEDA, Lagos analyzed the structure of its workforce and divided it into two broad categories. First, enterprises with fewer than 100 employees, predominantly SMEs, and second, those with 100 employees or more, largely large corporate organizations. Organizations with fewer than 100 employees may enroll their workers under the state subsidized social health insurance, Ilera Eco scheme, or any of the private LPHP premium plans. These organizations support more than 95% of our workforce, traders, artisans, small business owners, innovators, and transport workers who shape our communities. Providing this flexible option strengthens families, stabilizes businesses, and sustains our economy. For organizations with 100 employees and above, the former private sector, the state has established an obligatory pathway through the LPHP. This enhances risk pooling, strengthens formal sector coverage, allows cross subsidies and risk equalization, and reinforces our commitment to building a healthier workforce through social equity. The private LPHP premium options are actually and actuarially determined to include the basic minimum package of health services required by law. These eliminates the inconveniences of purchasing an additional social health insurance plan, ensuring that one LPHP plan guarantees full compliance and essential coverage. Our private healthcare providers remain essential to our progress. Over 70% of healthcare encounters in Lagos occur in private facilities. Their role is central to health outcomes in our families and communities. LPHP creates a more transparent, sustainable, commercially viable environment for their continued service and growth. Lagos has also prioritized digital transformation in healthcare financing. In collaboration with Sterling Bank, we developed a digital compliance and health financing platform that enriches data visibility, strengthens transparency, and enhances governance. It equips us to track enrollment trends, monitor utilization, identify gaps, and guide policy decisions with precision, preparing Lagos for the future. Our reforms continue to align healthcare financing with improvements in service delivery. Through the healthcare infrastructure blueprint of this administration, we are revitalizing primary healthcare centers and secondary facilities across all our local government areas and LCDAs. Major expansions, such as the new general hospitals in Shomolu and Ojo, the Mercy Children's Hospital, and the Mental Health and Addiction Rehabilitation Hospital in Ketsu Ejiri, and narrowing the healthcare infrastructure gap. We are advancing the Lagos Comprehensive Cancer Center, the Medipath Complex on Aulo Road, and the Omotunde Ajoke Core Smart Hospital within the Lagos Island General Hospital. All these are excellent examples of successful public-private partnerships. We understand the global mobility of health professionals, largely driven by economic opportunities. This has shaped our workforce planning. We are expanding training capacity through the University of Medicine and Health Services, Lagos, and implementing a brain gain strategy that encourages skilled professionals to return home. Our PHP strengthens this ecosystem by making the health sector more economically attractive, professionally rewarding, and efficiently run. As we celebrate this achievement, we acknowledge the collective effort behind it. We appreciate the NHIA for their strategic partnership. We commend private health insurance for their professionalism and private healthcare providers for their unwavering dedication. We thank Sterling Bank for powering digital transformation. We celebrate the Ministry of Health for its commitment to excellence. Today, we launch a pillar that strengthens financing reforms, expands social protection, empowers providers and insurers, and enhances residents' confidence in their health system. This is a moment that invites unity, a moment that calls for deeper partnership, a moment that opens a new chapter in healthcare for Lagos State. Distinguished ladies and gentlemen, Lagos is rising because its people never stop believing in progress. Their government consistently chooses action and collaboration. The Lagos Private Health Partnership represents our readiness for greater responsibilities and stronger systems that protect every household. The journey ahead creates opportunities for wider coverage, higher service quality, deeper investment in our health workforce, stronger facilities, and a healthier population. Be assured that Lagos will seize these opportunities with clarity and conviction. Let this launch inspire commitment from all stakeholders, families, employers, insurers, and providers. Let it keep our skilled talent right here in Lagos. Let it position our state as a leading medical tourism destination in Africa. With pride, gratitude, and faith in the people of Lagos, I reaffirm as your governor our dedication to building a healthier, stronger, and prosperous Lagos State. Thank you. The work continues. The progress deepens. The future is bright and promising. I thank you all for listening. God bless Lagos State. God bless Nigeria.
Governor, thank you. Can you give her, our SSG, another round of applause? Mark, can we crave your indulgence that you please help us proceed towards the unveiling of the lunch this way? Thank you. Thank you so much, Mark. Please, can you give our SSG another round of applause? Can I ask the ESCO members to please join? ESCO members to please join. Okay, let's welcome as well the HC Commerce, Honorable Commissioner of Commerce, Mrs. Falashade Ambrose Magbem. Can you give her a round of applause, ladies and gentlemen? Thank you very much. Please, ESCO member and Chairman Lashma to please join for the unveiling. Yes, over there. Over there. Yes. You help us pull the ribbon? That's about it. Okay.
The Lagos Private Health Partnership Scheme. Open. Oh.
Sorry.
A round of applause, ladies and gentlemen. Thank you very much. That's the unveiling explaining the digital. Thank you very much. Now for the photo session, please can we have ESCO members join the SSG as well as Chairman of HSC, President HFN, National Advisor HCPAN, and NECA. Please can you make way? Can you go down, please? And let's, please, photos. Thank you very much. Can we have the ESCO member join as well as, thank you very much. Thank you very much. The SA, the representative of the Special Advisor on Health, Mrs. Sarah, should please join them as well. Thank you very much. The Chairman of Health Service Commission, I can't see her there. Cameraman, can you move back so that we can have depth of view? Thank you, thank you. Thank you very much. After this, can we have our permanent secretaries, if they are still here? Our permanent secretaries, please, can we join them, please? Can we have our permanent secretaries join them? Thank you very much. Can we have the permanent secretaries join them? Thank you very much. Thank you very much, our permanent secretaries. Thank you for being partners. Can we have the private health partners? Private health partners, can we join them on stage? Thank you very much. Private health partners. Private health partners, should please come forward. Thank you very much. Thank you very much. Can we, please, can you go, while we still crave the indulgence of the SSG to please wait while we, HC Health, don't go yet. SSG don't go, please, ma'am. Can we have the private partners? HC Fund, private partners. Please, Don't go yet. Can we have the SSG? Please, excuse me, sir. Don't change the position. SSG, ma, please, we still need you here with the HC Health. Wait, thank you very much. Please, can I crave your indulgence? All of you, can you please move back? And besides, you can't be shaking against the lights. This place would have been a more preferable place to be, but it's okay. Can we have the private? Thank you very much. Thank you. Thank you very much. From Aliko Dangote. After this, we have the directors from the Health family. Thank you very much. Can we move back so that we can capture? It is better. We can use the lenses. Thank you. Are we good? Are we taking it? Okay. After this, can we have the directors from the Health family? Please, can you take your pictures and stop arguing? Thank you. Thank you. Thank you very much. Ma, don't go. Directors from the Health families, please. Can we have the directors from the Health family? Thank you very much. All the directors from the Health family. This one, I know get time, I did that. Please, every HP team should please come forward. LPH team, please. LPHP team, please. Can you join the governor? Thank you very much, our directors from the Health family. Please, can we have on stage the Lagos Private Health Partnership team? Please, can you? Thank you very much. LPHP team, please. Yes. LPHP team, please join. Thank you very much. Thank you. Wherever you are, please can you make your way? Thank you very much for your dedication to providing quality healthcare to majority of. Thank you. Please, can you just, excuse me, sorry, can you just move back a little bit so that they can capture everyone? Thank you. Excuse me, sir. Thank you. Different things them happening, schemes and packaging. In a one night for shows, I'm juggling. Flow like the ocean, my boat, I'm paddling. Sharashina fella, that's my bro, my family. Thank you very much, Your Excellency, the Governor of Lagos State, the SSG. Thank you, Ma, for your time. At this point, I would like to invite to the podium the Acting Permanent Secretary, Lagos State Ministry of Health. There she is. Dr. Folashade, the leader for the vote of thanks. Thank you very much. The event is not over, and please be on your seats. Attention. Thank you, ma'am. Your Excellency, ladies and gentlemen, please can we make our way to our seats as we have the vote of thanks from the Executive Governor of Lagos State, Mr. Babajide Olushola Sanwo-Olu, ably represented by Barrister Salu Onde. I acknowledge the presence of all the ESCO members also here present and body of permanent secretary. Today marks a very significant day and indeed an epoch making event for every member of the Health family. It is indeed a great honor for me to give this vote of thanks at this event. Our noble, energetic, hardworking, and strong governor of Lagos State, Mr. Babajide Olushola Sanwo-Olu, thank you very much for your remarkable and good attention you've always given us in the health sector.
We are feeling you all around, and we appreciate your presence and support in this program. To all our esteemed guests, and especially the private sector, and of course, the bankers and the entire health family appreciates your presence. And on behalf of the Honorable Commissioner for Health, Honorable and Professor Akin Abayomi, and the Special Advisor to Mr. Governor of Health, Dr. Mrs. Kemi Kuyemi, who is unavoidably absent. We want to appreciate, I'm highly honored to appreciate your presence here, both your permanent secretaries here present, our directors here present, our esteemed partners here present, especially the private health partners. And finally, I want to wish all of us journey messages back to our various destinations as we continue in this great initiative and expect future and continued positive partnership. Thank you very much.
Thank you very much, our Permanent Secretary, Ministry of Health. Thank you very much, Ma, for your time. I know the time has been fast spent. At this point, I want to say thank you very much, everyone, for being part of this wonderful occasion as we provide equitable access to healthcare for every Lagosian. Thank you for being part of this launch of the Lagos State Health Financing Reforms. You are most welcome for being part of this journey as we ensure that every Lagosian is captured for quality and affordable healthcare. Thank you for being here till this time. My name is Joshua Akibola Murakio, and it's been a pleasure to do this. God bless you and thank you.